Faites l'appel, s'il vous plaît, Madame le greffier.
Monsieur le connétable de Saint-Hélier.
Présent.
Madame le connétable de Saint-Laurent. Monsieur le connétable de Saint-Brelade. Monsieur le connétable de la Trinité.
Présent.
Monsieur le connétable de Saint-Pierre.
Présent.
Madame le connétable de Saint-Martin.
Présente.
Monsieur le connétable de Saint-Jean.
Présent.
Monsieur le connétable de Saint-Clément.
Présent.
Monsieur le connétable de Grouville.
Présent.
Monsieur le connétable de Saint-Ouen.
Présent.
Monsieur le connétable de Sainte-Marie.
Présent.
Monsieur le connétable de Saint-Sauveur.
Présent.
Monsieur le député Southern. Madame le député Labbé.
Présente.
Monsieur le député Tadier. Monsieur le député Luce.
Présent.
Madame le député Dublé. Monsieur le député Morel.
Présent.
Madame le député Lehegara. Monsieur le député Ayer.
Présent.
Monsieur le député Ward.
Présent.
Madame le député Alves. Madame le député Gardner. Monsieur le député Ghost. Monsieur le député Farnham.
Présent.
Madame le député Moore.
Présente.
Monsieur le député Mezek.
Présent.
Monsieur le député Ozef. Monsieur le député Balash.
Présent.
Monsieur le député Coles.
Présent.
Madame le député Porret. Monsieur le député Wall. Madame le député Miles.
Présente.
Madame le député Scott.
Présente.
Monsieur le député Renouf. Madame le député Curtis. Madame le député Feltham.
Présente.
Madame le député Binet. Madame le député Jeune.
Présente.
Madame le député Miller.
Présente.
Madame le député Howell.
Présente.
Monsieur le député Binet. Monsieur le député Ferry.
Présent.
Madame le député Kovac.
Présente.
Monsieur le député Curtis. Madame le député Ward.
Présent.
Madame le député Wilson.
Présente.
Madame le député Stevenson.
Présente.
Monsieur le député Andrews.
Monsieur le doyen.
Notre aide soit au nom de Dieu qui a fait le ciel et la terre. Amen. Seigneur Dieu, Père éternel et tout-puissant, qui a établi le gouvernement et les puissances de la terre, pour le règlement et pour la conduite du peuple, et qui nous a commandé d'avoir toujours pour but la gloire de ton saint nom. Nous te prions qu'il te plaise de donner à cette assemblée le don de conseil et de prudence, d'unir le cœur et les affections de tous ceux qui la composent, de la conduire tellement toi-même par ton Saint-Esprit que toute l'heure de l'opération est accompagnée de ta bénédiction. Réussisse au bien et au soulagement du peuple qu'il te plut de commettre à leurs soins. Car nous t'en prions au nom et par le mérite de ton Fils bien-aimé Jésus-Christ, notre Seigneur, qui nous a enseigné de t'invoquer en disant: Notre Père, qui es aux cieux, ton nom soit sanctifié, ton règne vienne, ta volonté soit faite sur la terre comme au ciel. Donne-nous aujourd'hui notre pain quotidien, et nous pardonne nos offenses, comme nous pardonnons à ceux qui nous ont offensés. Et ne nous envoie point en tentation, mais délivre-nous du mal. Car à toi le règne, la puissance et la gloire, au siècle des siècles. Amen.
Madame le connétable de Saint-Laurent. Vous jurez que Madame le connétable de Saint-Laurent est tellement indisposée qu'elle ne peut pas assister aux états sans exposer sa santé. Monsieur le connétable de Saint-Brelade.
C'est faux.
Monsieur le député Southern. Monsieur le député Tadier.
Présent.
Madame le député Dublé.
Présente.
Madame le député Alves.
C'est faux.
Madame le député Gardner.
Présente.
Monsieur le député Ghost.
C'est faux.
Monsieur le député Hauser.
Présent.
Les États sont constitués.
Could I lift the depot on Deputy Alves?
Members agree to lift the defo? Yes.
So I have a medical appointment later this morning, if I might be excused for that.
Thank you very much. Anton? Very well. On behalf of members, I'd like to welcome His Excellency the Lieutenant Governor to the Chamber this morning. This is his first ordinary sitting of the Assembly, so he'll come away with a good first impression or a bad first impression, depending upon how it goes. There are a number of subordinate enactments under B. Also, a number of matters have been presented or laid as described in the consolidated order paper under section C. Under section D, we have the draft income support amendment number 2 Jersey regulations, P94 amendment lodged by Deputy Southern. Draft income support amendment number 2 Jersey regulations, P94 second amendment lodged by the Minister for Social Security. Draft employment minimum wage amendment number 17, regulations P99 lodged by the same Minister. Cost of living crisis, removal of 5% goods and services tax, GST from food, excluding alcoholic drinks, lodged by Deputy Kovacs, P100. States of Jersey Development Company, reappointment of 2 non-executive directors, lodged by the Minister for Treasury and Resources, P101. Draft Finance 2023 Budget Jersey Law, P102, lodged by the Minister for Treasury and Resources. Draft Finance 2023 Budget Jersey Law Addendum, lodged by the same Minister. Draft Criminal Justice Deferred Prosecution Agreements, Jersey Law, lodged by the Minister for Home Affairs, P103. Draft Non-Profit Organisations Amendment of Law, Jersey Regulations, lodged by the Minister for External Relations and Financial Services, P104. The next item on the order paper is under F, appointment of ministers, committees and panels, which is the appointment of members to the Bailiffs Consultative Panel, for which members should have found an explanatory note at the end of the order paper. There are 5 vacancies on the panel who will join the Chief Minister, the Minister for Treasury and Resources, the Chair of the Privileges and Procedures Committee, and the Chair of the Comité des Connétables to serve for the next 3 years. The 5 members will be elected by secret ballot by this Assembly. Nominations are made on the floor of the Chamber, and each nomination must be seconded. If more than 5 members are nominated, there'll be a secret ballot. The 5 members who receive the largest number of votes will be elected to the panel. In the ballot, each member will be able to cast up to 5 votes. I therefore would like to invite nominations for membership of the Bailiffs Consultative Panel.
Sir.
Yes, Deputy.
So, thank you. May I nominate Deputy Kovacs?
Deputy Kovacs, is that seconded?
Yes, sir.
Any other nominations?
So may I propose Deputy Ferry of St Saviour?
Ferry, is that seconded?
Yes, sir. Yeah, second Deputy Ferry.
So I'd like to propose Deputy Caroline Labby.
And is that seconded?
So I'd like to propose the Constable of St Helier.
Constable St Helier, is that seconded?
Tis, sir. So I'd like to propose Deputy Farnham as a backbench member.
And is Deputy Farnham's nomination seconded?
Yes, sir.
Are there any other nominations? Very well. There are 5 nominations, 5 vacancies, and I declare that Deputy Kovacs, Deputy Ferry, Deputy Caroline Labby, Deputy the Connétable St Helier and Deputy Farnham are appointed to the Bailiffs Consultative Panel. There are no matters under G or H. Written questions, answers have been tabled, and they are available to members in written form. We come now to oral questions with no... Yes.
I wonder if I could seek your guidance on a matter of procedure. I note from the order paper today that the Infrastructure Minister is due to make a statement about the hospital review survey. That's due to come after questions without notice to ministers.
Yes.
I wondered if it would be in order to question ministers, particularly the Chief Minister, prior to the statement being made, given the fact, sir, that the report was circulated, embargoed until the Infrastructure Minister gave his statement.
So what is it you're asking? You're asking if the Minister can give his statement before questions without notice, but after questions with notice, presumably?
Yes, I think that would then enable members to ask questions of the Chief Minister and other ministers.
Well, obviously that is a matter for members. Do you wish to make that as a proposition?
Yes, please, sir.
Is that seconded?
Yes, sir.
Does any member wish to speak on the proposition? If no member wishes to speak, I close the debate. Those in favour of the proposition kindly show. Those against? Very well, the proposition is adopted, and we will deal firstly, therefore, with questions with notice, then we will deal with the ministerial statement, and then we will move to questions without notice. Very well. We start then with questions with notice. Oral questions with notice, and the first question Deputy Feltham will ask of the Minister for Children and Education. Deputy.
Will the Minister advise whether she is aware of any barriers to children with sight problems obtaining the early diagnosis and support which is required to ensure that their educational and social development is not affected by undetected or untreated sight issues?
Minister.
So thank you for Deputy's question, and I have checked with the visual impairment team in my department, and I'm not aware of any barriers within my remit. The diagnosis of the sight problems rests with the Minister for Health and Social Services. Once a diagnosis is confirmed and communicated to SIPE's visual impairment team, then make contact with the school, nursery, home or college, regardless the age. It's open for all ages, and usually complete an initial visit to identify any support required within 3 weeks during term time. Any work carried out in schools, nursery, homes is documented and sent to both home, school or nursery, or any other childcare arrangement, that everyone has consistent information how to move forward. The visual impairment team work very closely with orthoptic department at the hospital and have an excellent relationship, for what I've been told.
Supplemental question?
Yes, sir. Currently, I can run a voucher scheme for children requiring glasses and visits to the opticians. Would the Minister commit to working with the other ministers that she mentioned to ensure that children who may have difficulty affording eyewear can obtain them as and when they need them, so that they do not have impaired vision during their educational classes?
Thank you for the suggestion. And yes, I can definitely charity that currently offer £90 voucher towards children glasses for children under 8, and will offer more support if the families need, and if they apply directly to the charity. I will commit also to work with the Minister for Social Security, because the financial help for glasses would come through the Minister for Social Security.
Very well. Deputy Rawald.
Thank you, sir. May I ask the Minister, is the Minister confident that there's mechanisms in place for teaching staff and teaching assistants who work so closely with young people, if they do spot something that might be a problem with eyesight? I know as a parent myself, it can be difficult to spot it and you might miss it. Thank you, sir.
First of all, from what I know, and I'm happy to have the other conversations, that referrals made directly to the orthoptic service team by house visitors or school nurse, and teachers can raise it with the school nurse. Also, what's really important to emphasize that the orthoptic department run a visual screening service in both public and private schools where the eye test is offered for all reception age children. The orthoptic department also offers an early year test for every child in Montelabe, which is undertaken in the school with the support of the visual impairment team. If it's something that Deputy is aware about specifics, I would be welcoming a conversation.
Supplemental, Deputy?
Yes, thank you, sir. The Minister mentioned school nurses. Can I just check that there are school nurses in every school and they have access to... I'm genuine question because I don't know. Thank you, sir.
Yes, I had a meeting a couple of weeks ago, I think, with the family nurse, and I have been confirmed there are school nurses in each school. And we have raised that it would be helpful if school nurses will communicate direct with the parents, and I've been reassured this will be raised back.
Deputy Southern.
Thank you, sir. And once again, we find ourselves dependent on charitable funds in order to deliver a particular service. Does the Minister not consider that she should be sharing with her colleagues, especially the income support colleagues, who might be able to use special payments as a means of delivering the cost of tests and the costs of subsequent eyewear?
What it's important to emphasize that the support coming from not just from this charity, it's also coming from the Social Security. I'm unsure about the restrictions and application for this process, and I'll be happy to work with the Minister for Social Security to explore this further.
Supplemental, Deputy?
Yes, sir. It's my understanding that certainly in the past, this fund, the Special Payments Fund, has been used for medical purposes. Surely this would count as a medical purpose. Does she not consider that?
I think so. This question for the Minister for Social Security, and I need to have a conversation with the Minister to explore this further.
Final supplementary then, Deputy Felton.
Is there any provision within the government plan that the Minister considers could be used to provide support for children whose educational career may be impacted by poor vision?
I need to look into this and to work with the Health and Social Care and Social Security Minister on this.
Very well. We come now to question 2. The Deputy Southern will ask for the Minister for Health and Social Services. Deputy.
Thank you, sir. Will the Minister outline any plans under consideration for the funding of primary care services? Advise what, if any, discussions on funding have occurred between ministers responsible for the services and representatives of GPs and pharmacists? Whether a survey of public opinion around such funding is currently being conducted, and if that survey conforms to the highest possible standards of objectivity, when will the results be published?
Minister.
Thank you, sir. Thank you to the Deputy for his question. As set out in my answer to written question 174, the government plan commits me to bringing forward options for a new healthcare funding system, with a view to any new system being operational by 2025. And I can confirm to the Assembly that this work has started. We are going to contract specialists in health economics to support us to estimate the future total healthcare expenditure in Jersey, including out-of-pocket expenditure incurred by islanders, and to support us to examine future funding options. This could include funding via taxation, compulsory insurance, user pays, or any combination of these routes. In determining these options, we will consider fairness and how to incentivise the use of preventative services. We will be consulting ministers and all providers in early 2023. We're also conducting a survey to help us better understand the public's attitude to health funding. And the survey is due to be distributed in late October, but is slightly delayed as we've had some additional advice from the Chief Statistician on the design of the questions to ensure objectivity. As already committed, I will ensure the Deputy and his scrutiny panel are sent a copy of the survey before it's distributed. And it is anticipated that the results of the survey will be available in January 2023, and these results will help inform consultation with the providers.
Supplemental, Deputy.
Thank you, sir. The question arises then, what negotiations or what consultations are going on currently today? Not in 2 years' time, when you've come to some sort of conclusion about what's the way forward, but now, when GPs and pharmacists do not understand what's likely to happen next, have been insulted by the sums involved, the £20.28p that's been in place for 10 years and reflects how low we consider the GPs to be. Will the Minister state what progress she is making and what conversations she will have or has had with GPs and pharmacists delivering the primary care system, which so far appears to have been stymied?
Minister.
Thank you, sir. What I can assure the Deputy is that I have met with members of the primary care body, and I've also met with members of the pharmaceutical body. And we also have a piece of work ongoing around the primary care strategy, which involves these key stakeholders. And what I will be able to do is bring back to the Assembly the outputs of that. But what I can assure the Deputy is that there are conversations ongoing. I just want to pick up the point about who we speak with. And I think the important thing here is that we have to engage the public in understanding their attitudes to a health funding model before we can actually go and talk to the people who will be the recipients of that. And that is the position that we're taking on this issue.
Deputy Meze.
Thank you, sir. Does the Minister recall a previous survey that looked into public views on the funding of primary care, which showed at the time that there was majority support from patients for maintaining a fee to see the GP, which was used as justification at the time for maintaining a fee, but when you scratched beneath the surface, you discovered that those who supported maintaining it were those who could afford it, and those who opposed it were those who actually couldn't afford it, and therefore the presentation of that survey result led to flawed conclusions. Will she guarantee us that such a survey this time round will not do so?
Thank you, sir. Thank you to the Deputy for his question again. What I'd like to assure the Assembly is that this is a new government, a new Council of Ministers with a new and refreshed approach to the way we do things. The first piece of engagement work, as I alluded to in my written question earlier this year, was that we do want to support a better understanding of the implications of the costing and funding models for healthcare going forward. And as I've said before, the objectivity that we need in the survey results hopefully will address some of those issues and anomalies that the Deputy has highlighted in order for us to get the right information.
Supplemental, Deputy.
Thanks, sir. It may be a new government, but it's one whose ministers are seldom able to give us any clarity about what's actually tangibly going to happen to any of these policies, and instead simply says they're reviewing everything. So will the Minister attempt now to give us some clarity on what she believes is the direction of travel that ought to be pursued to make primary care more accessible for those who need it?
Thank you, sir. Thank you. I mean, what I won't be forced into or rushed into is making any snap decisions about how we do things. And as the Deputy will appreciate, with, I think it's 107 days in, we need to understand the evidence base for how these things are. But I appreciate there is evidence there that is really important to incorporate as part of the review. And I can absolutely assure him that action will be delivered on this very quickly.
Deputy Rob Wall.
Thank you, sir. May I ask the Minister, will the Minister commit to ensuring that any public consultation is inclusive of all of our communities? And by that, I mean not just different languages, but I mean different abilities, those who are perhaps with learning disabilities, those who are at the bottom of our income scale, who perhaps don't engage, well, not perhaps, absolutely don't engage in these surveys. Thank you, sir.
Thank you, sir. Thank you to the Deputy. I mean, we're hoping to circulate about 3,500 survey questionnaires across the island. But what I will guarantee is that we will actually make sure that those surveys will be representative of all of our communities and that they will be written and communicated in a way that is inclusive and able to capture the views of all people with all needs across the island.
Supplementary, sir?
Yes, indeed.
I asked the Minister to be aware that literacy issues are not just those that are linked to the English language, but they are linked to all languages that are spoken and used on this island. So just sending a leaflet in another language is often not just enough to engage people in a consultation. Thank you, sir.
Thank you, sir. We will be putting a communications framework around this, I can assure the Deputy, and we will make sure that we reach out to every single citizen as far as we possibly can. Clearly, it will be people's choice to engage with us, but the method by which we actually involve and participate, support participation, will be very different to what he's experienced previously.
I have Deputy Alves, Deputy Feltham, Deputy Balash, and then final supplementary, Deputy Southern. Deputy Alves.
Thank you, sir. Is the Minister able to inform the Assembly how much is spent on primary healthcare and how this compares to other OECD countries? Thank you, sir.
I'm sorry, sir, but this, thank you for the question. The detail around this does not rest with my portfolio, but I'd be happy to work with my colleague, the Minister for Social Security, to bring forward that detail.
Supplemental, Deputy Alves.
Will the Minister come back to the Assembly with that information then, please? Thank you.
So, yes, I can confirm I will.
Deputy Feltham.
Thank you, sir. In her initial answer, the Minister referred to potential for compulsory insurance as being one of the potential funding mechanisms. Does that mean that the government is currently looking at privatising other areas of the health service that are currently being run by government?
Thank you, sir. I think the Deputy raises a very interesting question, but what I can assure you is that our focus around sustainable healthcare funding relates purely and solely to the way in which we actually currently fund our health system. And we need to be able to look at all options to make sure that this funding mechanism is sustainable, the details of which I clearly want to bring back to the Assembly in due course.
Supplemental, Deputy. Deputy Balash.
So is the Minister aware that officials conducting this review have not responded to requests from the primary care body for a meeting, and will she encourage those officials to do so?
Thank you, sir. Thank you to the Deputy for the question. I wasn't aware, but I do know that there were and are a number of meetings held with primary care colleagues, and have actually been present at some of those myself, but I will take the question that the Deputy has raised, and we'll seek further information on that and address that directly.
Supplemental, Deputy. Final supplementary, Deputy Southern.
Can the Minister confirm that she has had no more than one meeting with GPs, and will she give a date, not a quick reaction, but a considered reaction? Will she give a date by which she will come back to the House and state how primary care will be continued from now onwards, in the short term and the medium term, not necessarily in the long term?
Thank you, sir. Thank you, Deputy. What I want to outline is that this is the first phase of a piece of work to develop the proposals going forward. The second phase will take place in Q3 of 2023. And what I'm proposing to do is to actually bring updates along the way to the Assembly to let them know where we are in relation to the developments of these proposals, so that the Assembly is kept informed fully of the progress that we're making.
Very well, we come to question 3. The Deputy Andrews will ask the Minister for Infrastructure. Deputy.
Will the Minister advise how the expected costs of renovating and maintaining state-owned buildings are appraised, and in particular whether such costs are determined as a percentage of the individual property value or in relation to the value of the whole state estate?
Minister.
Sir, I'd like to thank Deputy Andrews for his question. So the maintenance and upkeep of the estate is based on its use and the operational requirements of the function of the building, not its value or the value of the estate. The priority is to ensure the best endeavours are undertaken to make the building safe to occupy and to operate. In the past, where maintenance is set with individual departments, it's been very easy to divert some of the elements to other uses, projects or resources, and this has resulted in an overall decline in an ageing estate. This approach was exacerbated by the fact that in the last 5 years the budget has fallen by about 3.5 million per annum under savings and targeted measures, which in real terms is a 45% drop on the current 2021 budget of 7.6 million. The shortfall will be addressed over the coming year, sir, by undertaking a full condition survey of the estate, then targeting and prioritising the resultant works with the budget.
Supplemental.
Thank you, sir. Does the Minister believe that data trends should be established to provide data on the renovation costs as a percentage of the overall estate value? Thank you, sir.
Sir, I believe that's going to be part of what's undertaken with the property review over the coming 12 months. We've been granted £600,000 for that purpose.
Deputy Tadier.
Thank you, sir. When I speak to constituents and the wider public, they say to me that the state continually lets their own properties run into the ground, don't invest in them, and therefore they find an excuse to ultimately sell them off. Does the Minister accept that this practice needs to change under his leadership, and that the Opera House is a good case in point, where we've seen a building with a tenant where the landlord is Property Holdings, and it's been underinvested for decades, only to now be in a situation where it's shut, we're being told, for the next 2 years?
Minister.
Sir, as the Health Minister said, this is a new government, and I think we can expect a new approach. We will be looking at the property survey that will be undertaken, and I'm sure that we will be taking, hopefully, a more proactive approach to dealing with our property matters.
And so it's a new government. Does the new approach mean that when the report comes back and finds we've got so many properties that we can't afford to do up, that the automatic approach won't be to sell off the family silver, but it will be look to replacing the money from those decades of underinvestment to make sure that we've got a portfolio that is fit for purpose?
I don't think it's wise for me to preempt what will happen over the coming years, other than to say that a constructive approach will be taken. We've yet to undertake the survey, so I think it's a little bit early in the day to commit to anything.
Deputy Sutherland.
Thank you, sir. Will the Minister accept that the easiest way to save on any budget is to cut back on maintenance? And we saw this with our own housing stock for the past 2 decades, which was led to rot and has now cost a fortune to repair. Is it not the case? And will he assure members, will he guarantee to members that a philosophy which lets... Please. Well done, Philip. You just put me off there.
Please, through the chair, no, well done, Philip. That is not parliamentary language, Deputy.
Is it not the case that under his leadership, this philosophy of letting things go will be stopped?
Minister.
Sir, I don't think, once again, that it's appropriate for me to give any absolute guarantees. I think I've been in office for some 16 weeks. We need to take a full appraisal of the property portfolio and start making some sensible decisions about them over the coming years.
Supplemental, Deputy.
And so is the Minister saying that he will let maintenance budgets slip and slide, and will put up with buildings that are rotting.
So I don't recall making that statement, so the plain answer to that is no.
Deputy Rob Ward.
Thank you, sir. Let me give you, Minister, another chance. Can the Minister guarantee to this Assembly and to the people of Jersey that states' money won't be spent just to a point where something is saleable and then sold to a private enterprise so that they can make money where the state should be keeping its assets? Thank you, sir.
At the risk of repeating myself for the third time, sir, the answer is no. I'm not giving any guarantees of any description other than to say that I guarantee I will use my very best endeavours to treat the estate properly.
Supplementary, Deputy Roy.
Thank you, sir. Okay, can I ask the Minister, does he accept would he accept the spending of states' money to bring properties up to a standard and then selling them to private enterprise?
Sir, I'm sorry, I could ask that question to be repeated because I don't think I quite understood it.
Sorry, sir, I'll work on my diction. Does the Minister accept the spending of states' money on the repair of states-owned properties that could then be sold to private enterprise? Thank you, sir.
Perhaps I'm being a trifling, but I don't quite understand the question. I'm awfully sorry.
It seems to be, no, I don't think we can keep doing this. As I understand it, the question is being posed is the Minister accepting of a possibility where public money will be spent to bring properties up to standard and then they'll be sold to private enterprise? Is that the essence of the question?
Fairly obviously, there has to be a distinct possibility, but not a guaranteed fact.
Very well. Final supplementary, Deputy Andrews. Final supplementary, Deputy Andrews. Come to question 4, that Deputy Catherine Curtis will ask the Minister for Social Security. Deputy.
Thank you, sir. Will the Minister advise whether she is aware of the difficulties faced by teaching assistants in schools whose contracts of employment are for less than 35 hours per week and who are therefore unable to claim income support should it become necessary while they remain in post? And if so, is she prepared to consider introducing an exemption under the income support scheme for these essential workers?
Minister.
Thank you, sir. I thank the Deputy for her question. I can reassure members that it is simply not the case that teaching assistants are unable to claim income support because their contracts are for less than 35 hours a week. The income support system supports people who are both out of work and in work, including those who are working part-time. One of the basic conditions of our income support system is that working age claimants who can and are able to work should have a job working full-time hours if they can, or be actively looking for work. The income support scheme already has rules for people who aren't expected to work full-time because of a health condition or their caring responsibilities. It allows individual circumstances to be taken into account, and I do not currently have plans to change the work requirements under the scheme. In particular, I have no plans to create special rules for teaching assistants because there may be many other similar roles who would demand similar exemptions. I do believe, having discussed with the Education Minister, that there is some considerable misunderstanding around the role of teaching assistants in the availability of income support, and I have asked for a briefing to be given to the Population and Skills Ministerial Group in early course so that this can be properly understood and any actions necessary taken.
Supplemental, Deputy Curtis.
Is the Minister aware that head teachers in schools around the island are complaining that they are losing teaching assistants because the teaching assistants cannot claim income support due to their termly contracts and for working less than 35 hours a week? This is brought up to us frequently. There are 42 teaching assistant vacancies at the moment. It's a serious problem. And if there is a misunderstanding here, would the Minister undertake to write to each school explaining the situation in detail to clear up this misunderstanding?
Sir, the Back to Work team have gone directly to head teachers and offered them a direct contact with a senior manager in Back to Work. Head teachers are already aware that they can raise any issue where this is an issue. I believe there have been very few cases raised with the team. I would also suggest it's a matter for the teaching assistant to discuss their own position with customer and local services. As I understand it, some teaching assistants may be asked to work more hours, typically as their children are older, and they are able to work. There are guidelines, but each case is considered individually. I believe that out of hundreds of teaching assistants, a small percentage are getting income support, and within that, a small number are affected by the requirement to look for more hours of work. The requirement to look for more hours typically will arise during the summer holiday period. We don't ask teaching assistants to look for additional work during Christmas or Easter, but they will be expected where they can, and taking their own caring responsibilities into account, be expected to do additional work during the summer holidays where they can. They will be asked to meet with employment advisors. They may be offered training. There is usually a lot of work available for teaching assistants during the summer holidays with the youth service or with after schools and activity clubs. This requirement doesn't prevent people receiving income support, which continues to be payable.
Well, Deputy Southern.
Thank you, sir. And yes, this is workable. If the rules say it's workable, that's the attitude that seems to be taken by the Minister for Social Security. A far simpler solution is just take the pressure off. There are teaching assistants out there worried because they are rushing around trying to find a second job, which will keep them...
Point of order, sir.
And
this doesn't seem to be a question.
I think that's... a point of order has been raised, Deputy Southern. The Deputy is entitled to raise a point of order. What is your point of order?
It doesn't seem to be a supplementary question that we're hearing. We're hearing a statement.
Well, quite often, for a question to be intelligible, certain prefatory remarks need to be made, and it's a matter of judgment from the chair as to whether or not there are sufficient prefatory remarks or not. But you're quite right to observe that this is a time for questions and not for statements. Sometimes statements need to be made in order to pose the appropriate question. But you are right in principle.
Thank you, sir.
So may I raise a point of order? This kind
Yes.
of thing will happen time and time again. At what point, because we're an assembly of philosophers, it seems, at what point does a question become a question, sir? I know it can't be answered now, but maybe PPC could look at that. It may not be until the very last word that you know whether something is a question, and it may be a very good question for all we know.
Well, I'm sorry, but you knew perfectly well that was not a point of order. That is an abusive process to stand up and simply make a point and then say it should be referred to PPC. A point of order is an order for a decision by the chair and not a decision by PPC, as I'm sure you know. So the answer is that was not a valid point of order. Deputy Southern, if you'd like to carry on, but perhaps we could get to a question.
And my next breath, indeed, were it not knocked out of me by the knife in my back, was to do exactly that. Who are running around looking for second incomes and who are worried about the ability to look after their children and to do a job, who are doing, all right, less than 35 hours a week. Why doesn't the Minister just take the pressure off on this? There's 40-odd teaching assistants who are driven wild by the fact that they're treated one way by Social Security and another by education. Will she please take the pressure off?
That was the question.
It was. Sir, I have just said that I have asked for a briefing to be given to the Population and Skills Ministerial Group to consider this very issue. I could only suggest that if there are teaching assistants in that level of stress, that they talk to the Back to Work team at CLS to explain their situation. We are not forcing people into work who simply cannot work. If people have older children, if people have younger children, they will not be forced into work if they are caring for young children. If their child is 15 or 16 and it's during the summer holidays, then I think it's a reasonable expectation on the taxpayer who are funding the benefits that they will be asked to produce extra hours if their contract is such that they are not paid during that time. Thank you.
Well, supplemental, Deputy Sutton.
Is it really? To come round again so quickly? I think that answer is unsatisfactory. The fact is that many workers feel that they are being bullied back into doing more work than they comfortably can.
I'm sorry, that is a statement. That's not a question. And that is really, I'm sorry, Deputy Telly, this is not a general discussion forum. This is something that is directed to the Chair on all occasions. And perhaps members
So I've
could
just come
remember
back from a conference on the abuse and the suppression of parliamentarians to be able to speak freely in their own assembly, sir. And if Deputy Southern puts, does the Minister not agree, at the end of that, as he well knows, that is the question, sir.
I beg your pardon. Was that a speech, Deputy? Was that a question? Was that a point of order? What part of standing orders did that fit within? I can assure you it fits within none, and this is an abuse of your position as a deputy, simply to stand up and express your views and interject in an improper way. Please refrain from doing so.
So I will raise a point of order, and the point of order, at what point does it become an oppression of states members' privileges to be able to do their jobs that they're in here to do? If we don't wait a few seconds, we've wasted more time with these interruptions than we have with basic courtesy, with letting members finish their questions.
What is the point of order you wish a ruling from the Chair on?
So my point of order is, at what point do we decide, sir, when we don't allow questions? Because often I've heard the Chair call on somebody and say very politely, and the question is, does the Minister agree, sir? You've done that on many occasions.
I have.
And I was trying to do that subtly to my colleague, saying, that is the question, sir. And I just want to try and get this back to some semblance
But what is the point of order on which you wish a ruling from the Chair?
Point of order is, sir, it was a question from Deputy Southern, wasn't it? He just forgot to put does the Minister not agree at the end?
Well, it was not a question in my judgment. If he had put those words, it might have been. But these interjections are not helpful, and they are not the way an assembly should proceed. They should proceed in accordance with standing orders, because it is by abiding by standing orders that everyone gets a fair opportunity to participate in questions, answers, and debate. If we just decide to go off on a course of our own, ignoring standing orders, then there will be chaos in the Assembly, and that is simply to be avoided. So let's try and keep standing orders in mind, please. Deputy, I will give you the opportunity to pose that question.
And I'm perfectly content to obey your ruling, sir. Thank you.
Much indeed. Very well. Deputy Rob Ward.
Thank you, sir. Can I ask the Minister, does she understand that teaching assistants working full-time, term time, are under an incredibly stressful job? And without the holiday breaks, they are burning out. And that's one of the reasons TAs are leaving the profession. Thank you, sir.
So, as I said, I've asked for a briefing to the Population and Skills Ministerial Group, where all these points will be considered. Many people work very long hours without the advantage of a very long summer break.
Well, supplemental, Deputy Ward.
Yes, sir. Can I ask the Minister... in fact, sir, no, I don't have a supplementary.
Deputy Kovac.
Thank you, sir. Is the Minister aware that the income support calculates for the term time employment, which addresses mostly to teachers, the salary that way, that although it's term time, it's spread across the whole year, and then the back to work actually requires them to find additional work ongoing, not just within the summer or holiday term. And that's where the pressure is. And would the Minister agree to look into that?
Minister.
Again, I've asked for this matter to be brought to the Population Skills Ministerial Group. I will also be conducting a review of benefits which will look at all these aspects. I'm not quite sure if the Deputy's question was extending into teachers who are paid over the summertime or teaching assistants, some of whom I believe are paid for the summer months and some who are not paid for the summer months. So there are clearly a number of issues that need to be properly considered, and we will be doing that in due course.
Supplemental, Deputy?
Yes, I was mentioning teachers, but it's actually teaching assistants which are not paid over summer month, but the calculation of the salary is still spread over the full year, and the requirement is still along the year, not just for the summer holidays. Obviously when they work full hours within the year, they're not able to do so. So that's where is the minister, does the minister agree to look into that process?
I think I've just said that, sir. Thank you.
Well, I have Deputy Feltham, Deputy Alves, and then final supplementary. Nothing more on this question. Deputy Feltham.
Thank you, sir. From her previous answers, the Minister seems to be suggesting that this is not an issue that can be resolved by her as Social Security Minister. With that in mind, and considering that these people are working in a very critical position that are keeping our schools running, does she think it is the role of their employer to perhaps improve their pay and conditions so that they are less reliant on social security?
No, sir, I don't think that's the case. That's not what I'm saying. The social security system supports people who need support with their income. There may be teaching assistants who don't need support because of their personal circumstances. There may be some who do. The income support system is aimed at working fairly. There are numerous people who work part-time who get income support who will also be asked to do more work where they can to make up their hours to full-time. That is fair to everybody who claims income support, and it's fair to the taxpayer who funds it. Thank you.
Supplemental, Deputy.
Yes, sir. Given the Minister's comments today, would she undertake to meet with some teaching assistants so that she can understand their views and also their workload and why they require their summer break?
Sir, I'm very happy to meet with teaching assistants if that would be helpful. However, I'm somewhat confused that we're talking about teaching assistants who are working full-time and part-time and the need for summer breaks. But I'm very happy to meet with teaching assistants and hear from them if that would be helpful.
Deputy Alves.
Thank you, sir. So, the Minister has mentioned caring responsibilities, and I'm assuming that this includes childcare, and that people in this situation, teaching assistants, would often be asked to look for more hours during the summer break. If they have childcare responsibilities, can the Minister inform us up until what age would this be seen as a responsibility for these individuals working as TAs? And as often the income support system subsidises childcare, and does the Minister not agree that if these individuals are asked to look for more hours during the summer break, which is often not a break, then income support would then have to subsidise the childcare, which negates the whole point and actually probably makes it more expensive to the system? Thank you, sir.
Minister.
Sir, I'm afraid I don't know the age at which children are considered not to need support from their parents. However, the income support system does take into account caring responsibilities, and where someone's caring responsibilities allows them to work, they will be asked to do so. Where that's feasible, it allows individual circumstances to be taken into account. If someone's circumstances or childcare needs, for example, a child of 16 may not need regular input and care from a parent, a child of 16 with special needs or disabilities may need more assistance from a parent. The income support scheme allows all of these things to be taken into account. And I say again, if teaching assistants are struggling with this, then I can only recommend that they talk to the team at Back to Work and Customer Local Services, who will give them a full information of what they can and cannot claim for and what is expected of them.
Supplemental, Deputy Alves.
No, thank you, sir.
Final supplementary, Deputy Curtis.
Does the Minister agree that the system is failing in this case and appreciate the urgency in this situation?
Again, I have asked for a briefing to the Population and Skills Ministerial Group, which will happen in November. It is being taken seriously, but I believe the information that I have is that in the number of teaching assistants as a whole, we are talking about a very small number of people who have issues with back to work and CLS and income support.
Well, we now come to question 5. The Deputy Tadier will ask the Minister for Economic Development, Tourism, Sport and Culture. Deputy Tadier.
Thank you, sir. Will the Minister confirm how long he expects the Opera House to remain closed, and will he undertake to bring forward the completion of the necessary works to ensure reopening by January 2024?
Thank you, and thank the Deputy for his question. Sir, I'd like to see the Opera House opened as soon as possible, and I will be pushing for it to reopen 2 events, obviously, in 2024. It's important to note, sir, that the revised opening date in the proposed government plan reflects the significantly expanded programme of works, which has been enabled by the allocation of a budget sufficient to deliver the full schedule of works required by this unique building. So we plan on tackling all of the more serious long-term structural issues with the Opera House. If we don't do that, these things will only come back to bite us later, as we know, and as the Deputy referred to earlier in this session. So this is a much bigger project than the one proposed prior to the government plan, and the timeline reflects the extent of the work we are now able to undertake.
Supplemental, Deputy Tadier.
Thank you, sir. The list of works that the Minister's provided in the written answer to my colleague Deputy Feltham is, I admit, quite extensive. It does include some very big project work, but also some minutiae I couldn't help noticing, like the doorbell on the front needs to be fixed. Is it possible that any of this work at all could be brought forward so that some or all of the Opera House could be used during the next 2 years, where it's due to remain shut, I believe, until Q4, we're told, under the current plans of 2024?
Sir, I will be maintaining pressure on the project team to ensure they work as efficiently as possible. And where there are opportunities to bring forward the opening date, we will take them. But, sir, it is an extensive list of work that is to be undertaken. Much of it is structural. Not all of it is very small. In fact, sir, we have already seen work, through the work that we have done already, we have seen problems with concrete in various areas of the building that needs to be rectified. That takes time, sir. And I think to underestimate the possibility that more discoveries are made during the course of the next 2 years would be to underestimate the difficulties of dealing with heritage buildings in this way. So, sir, I will maintain pressure on the team, but I can make no promises about opening it early.
Deputy Rob Ward.
Thank you, sir. May I ask the Minister, when does he envisage the staff at the Opera House being able to book acts for the future, as many of them are booked a year or so in advance, particularly the sort of acts that we want to, or performances, one might say, that we want to attract to Jersey? Thank you, sir.
So, with the aim to reopen at the end of 2024, then that would be when performances begin again at the Opera House. But what I will say is, in the interim, sir, it is my intention that the Opera House, the company element of the Opera House, as opposed to the actual building of the Opera House, will put on a programme around the island using the many venues that the island has. So there is no reason why the Opera House cannot be putting on performances and delivering a programme for islanders in the intervening 2 years. Thank you, sir.
Supplementary, Deputy.
Thank you, sir. And does the Minister accept that a certainty on when acts can actually perform is one of the key points to booking, particularly perhaps one might say the bigger names to Jersey, so we become a centre of performance, and that certainty of date is the key factor? Thank you, sir.
So the Deputy is absolutely right, and he's also right in the earlier part of his question where he mentioned that sometimes acts need to be booked a year in advance. That's absolutely correct. So providing the certainty to the new leadership of the Opera House will be very important, and we will be doing that. But as I said, in the interim, I'll also expect that leadership to be providing a programme of events that the island can enjoy.
Thank you, sir. How confident is the Minister that the sum allocated in the government plan for this work will be sufficient to see it through? And can he reassure the Assembly and the public that we will not see the same a disappointing end to a very prestigious project and opening, as happened last time round?
Sir, I'm not entirely sure what the Constable is referring to when he says, when the last part of his question where he talked about the prestigious opening not happening. I don't quite understand that, sir.
Could I clarify, sir?
If he doesn't mind, that would be helpful.
Well, all right. Untypically.
Yeah, I apologise, Minister, for not being clear. I was one of many islanders who were thrilled at the investment by the states in the last time the Opera House was refurbished and opened to great acclaim. And so many of us have been disappointed that that was not sustainable. So can you reassure us that this is not going to happen this time around and that the new Opera House, with all the investment, will continue to flourish for years to come?
Thank you, sir, and thank you for the clarification, Conatable. Yes, sir, I can assure the Constable that that is the case. It has been my stated intention from the beginning of this project, even when I was Assistant Minister in the last Assembly, sir, that we cannot have a situation where the Opera House does not have the funding to maintain itself over the years. We are in this situation precisely because consecutive governments have failed to provide the necessary funding to allow the Opera House Board to maintain the building itself. That can't be the case going forward, and I have made it clear to officers that I expect the future plans for the Opera House to include funding mechanism which allows the suitable maintenance over time, so we don't end up in this situation again, sir.
Supplementary, Conatable?
Thank you, sir.
Final supplementary, Deputy Taddy.
Thank you, sir. I thank the Minister and members for their interest as well. Sir, it seems to me that this is in a theme of what we've already been speaking about. And does the Minister agree that, in fact, we should be putting money aside every year in the budget for buildings like the Opera House to deal with depreciation? So even though money has been allocated now, and it seems like a lot of money, but that's very little when we look at it year on year as to what should have been invested. So does he agree that we, in order to not find ourselves in this situation again, sir, we should be putting aside money and a fund specifically for the maintenance of our buildings, whether that comes through property holdings or not?
Thank you, sir. That's certainly what I'll be doing with the Opera House, and on the face of it, without being the Infrastructure Minister, I'm not the Infrastructure Minister, neither am I the Treasury Minister, but on the face of it, everything that the Deputy just suggested seems to me to make common sense. Thank you, sir.
Well, we come to question 6. The Deputy Rob Ward will ask the Minister for Economic Development, Tourism, Sport and Culture. Deputy.
Thank you, sir. May I ask the Minister, will the Minister advise what assessments, if any, have been made of the financial security and adequacy of facilities of Jersey Bulls FC and Jersey Rugby Club, and whether there are contingencies in place should any potential issues arise? Thank you, sir.
Minister.
Thank you, sir. The Deputy has asked this to be answered by me in person, which is absolutely fine, but I would suggest that that my Assistant Minister, Deputy Stevenson, answers it, as she knows the subject more in depth than I do, sir.
Well, I'm afraid that on the list it's directed to you, Minister, and you are required to answer it. We can't chop and change around the order paper, I'm afraid.
So, can I just make a point? I wasn't aware you could do that, but I thought questions had to go to a Minister, just to say thanks.
No, I mean, it is possible to ask someone with ministerial responsibility for it who's not necessarily the Minister, but Minister, if you'd
Absolutely. Thank you, sir. As noted in the answer to written question 178, the former Assistant Minister for Sport met with Jersey Bulls earlier this year and requested details on their longer-term vision for the club. This enables the government to consider future support, including a long-term lease of government land by Jersey Bulls or any investment of taxpayers' money on the project. Officers and the Assistant Minister are still awaiting receipt of this information, but stand ready to assist Jersey Bulls on the development of their long-term vision. In the short term, new spectator improvements and perimeter fencing works were completed this summer at Springfield Stadium. This project, which involved around £1.2 million of spending, now allows Jersey Bulls Football Club to progress through the leagues. Sir, it is recognised that both the Bulls and the Reds are an important part of the sports landscape in Jersey and add huge value to the community. Sir, as the Minister and on behalf of the Assistant Minister, I can say that we celebrate their ongoing success as they move up through the ranks and wish them all the best for their seasons.
Supplemental, Deputy Ward.
Thank you, sir. And Jersey Bulls are self-funding in some way. Can I ask the Minister whether there is support for an additional hospitality facility on the site of Springfield for Jersey Bulls so that they can extend their income and extend the level of hospitality they offer on match day in particular? Thank you, sir.
Thank you, sir. Sir, I am personally unsure whether there is anything with regard specifically to hospitality. But, sir, I can say that there is the long-term vision for the club means that there is a 5 or 10-year plan. And if that is developed, then we'll be able to identify how we can best help and how we can enable them to provide the sustainable funding that they need going forward, whether that involves hospitality or not, sir.
Conor St Mary.
Thank you, sir. In the Minister's reply, he makes reference to the Jersey Reds. Just for clarification, the question refers to Jersey RFC. I just wish to make distinction. There is a distinction between Jersey RFC, which is an amateur-based section of the club, and Jersey Reds, which is entirely professional. And I interpret the question...
It's odd.
Sorry?
That doesn't sound anything like a question.
It's my I will come with the question. So
Yes,
would you please...
when I use the word prefatory remarks and preamble, I was conscious that I might be giving a lot of licence to people to make short speeches, and that's not my intention, nor will it be my practice. But please do ask.
I apologise, sir. My point was to seek clarification that his comment that he would not be giving facilities to Jersey Reds as such, given that they are a professional club, and that the question relates to Jersey RFC, the amateur side.
Thank you, sir. I believe the Constable is absolutely correct. It does refer to the Jersey RFC in the question, so I'd have to make sure that the answer pertains to that. But right at this moment, I'm unable to do so.
Supplemental, Conor.
Thank you, sir. I'll leave it at that. Thank you.
Very much. Deputy Mezzi.
Thank you, sir. As a Jersey Bulls season ticket holder, could I impress upon the ministers the importance of ensuring that there are adequate catering and commercial spaces available at Springfield Stadium when those matches are occurring? And could I impress upon him the importance that there could be for going to meet with those involved in running that team to discuss ideas with them and endeavour to find out what the government can do to help support them so that they get those commercial opportunities to make the club more financially viable?
Thank you, sir. Again, that does sound like a lot of sense. I can understand why catering facilities are important, particularly from not just the financial income perspective, but also from keeping the crowds happy during cold winter nights when they're watching some fantastic football. So, sir, I'm happy to do that. Thank you, sir.
Supplemental, Deputy Tadia.
So does the Minister agree that it's important to safeguard the future of both clubs, and that there's a paradox in that when either team become more successful, the cost of them participating in the sport also goes up, perhaps, should we say exponentially? I'm not sure if it's the correct use of the term. And does he think that, therefore, that in order to stop a situation whereby we find ourselves in them having to approach the government for bailouts all the time, that we need to look at a formal relationship and what level of government funding in the long term that they can expect with a mutual service level agreement from that?
Thank you, sir. It's a really interesting question, and it's one that I think we, as our sports teams, not just football or rugby, but as our sports teams improve and become increasingly professionalised, I think it is, and even in the amateur area, kind of become more and more involved in, and their expenses increase. I think we do have to find a way of understanding what level we want the government to fund at. Some of these decisions are taken by clubs entirely as private decisions, and it can be suggested that it was a private decision, therefore the consequences of those private decisions should fall upon the clubs themselves. Or do we as an island want to support that ongoing kind of professionalisation, but that does come with a cost. I agree technically it's probably not exponential increase in costs, but it is certainly a sharp increase in costs as these clubs rise through the leagues. So I think we need as an island to discuss what do we want, how much do we want to support it. Thank you.
Supplemental.
And so if it happens that the government is repeatedly giving money to these clubs, which I think personally is a very good investment, I've seen the tourism and the interest locally that it generates, does there then become a question at what point we consider being shareholders in those potentially very successful clubs?
again, a very valid question. It would also depend upon the status of those clubs in terms of the legal entity. You can only be shareholders in certain types of entities. Clubs and associations may not be the case. So again, there are so many technical elements to this, but I think those sorts of questions we do need to ask ourselves, because as an island, we've seen this with the Jersey Reds, how as they've gone up through the leagues, it does, in such a small place with such a small catchment area of fans, it does become very difficult to sustain financing. And so, yes, the island does need to think about how we best want to deal with that. Thank you, sir.
Final supplementary, Deputy Ward.
Thank you, sir. I'll change my rugby one because of my mistake in the question. Thank you to the Deputy for pointing that out. So can I ask the Minister, is he aware that Jersey Bulls actually are 100% responsible for the cost of airfares, travel and accommodation for visiting teams? And that is one of the huge costs that they have just to put those games on and be part of a league. Thank you, sir.
So I'm sure that is the case. As I said, the thing that I find interesting is that the decision to go into those leagues was a private decision made by the club itself as a private club. Therefore, how much the public purse should be responsible for that is the question we have to decide. These are private decisions, and they're ending up in public consequences. So if we want to support, that's fine. But as an island, I think we need to have that debate openly. Thank you, sir.
Very well. We come now to question 7. The Deputy Mezek will ask of the Minister for Children and Education. Deputy.
Thank you, sir. Could I just point out with this question, I've just noticed that it's slightly amended to the one which I actually submitted. It's included some extra words in it, which I'm not sure actually reflect what I wanted to ask. But can I ask it as it's on the order paper anyway, and we might do it?
Well, I think if you ask it as on the order paper, if you need to delve deeper with a supplementary, then perhaps that's the way to do it.
Yeah, thank you, sir. I just wanted to make that clear. Following the third improvement notice issued against Greenfields in the space of a year, will the Minister indicate whether she is reconsidering the previously accepted recommendation made by the Independent Children's Homes Association that the facility should be closed as a secure home and repurposed as a family therapeutic centre?
So before I'm answering this question, I would like to check with the Deputy. I have delegated responsibility for Greenfields and for Children's Services to my Assistant Minister, Konatap Vibert. Would Deputy Mezek would be content that this answer will be provided by the Konatap, although I accept I remain ultimately responsible.
So I'm afraid I wouldn't. Having been in her position before, I think there's elements that the whole Council of Minister would need to consider with this that wouldn't fall to Assistant Minister, so I would like it to be the Minister.
Very well, thank you. If I can just clarify the position, is that generally speaking, anyone with ministerial responsibility can answer a question, unless the questioner specifies it must actually be answered by the Minister. In this case, that has been specified, but that would be the default position. Very well, yes.
No problem.
Minister.
I will try to answer as many details as possible because I have delegated full responsibilities. And I would like to start my answer that I have found 2 reports, one from 2019, which followed the independent review of Greenfields. The previous Council of Ministers agreed to retain Greenfields as a small secure children's home. As the Deputy probably will know, following his time in the office of previous government that time. The review mentioned by the Deputy Mezek, if I understand it correctly, it's made by the Independent Children's Home Association and was review of all island children's homes, including 2-day review in August 2020 of Greenfields secure children's home. So 10 specific recommendations were made for future operation of the home as secure home. So in recommendation 3 of the report talked of a repurposing of the home, describing this as a resource center with a potential of 8 beds with outreach and multi-agency support. Further, sir, in response to recommendation 24 of the need to retain secure care, that government response was the secure children's home will be developed into a resource center, serving both the needs of the children and young people in secure and non-secure setting, with a therapeutic and trauma-informed operating model. So, sir, I'm supportive of the need to provide therapeutic care And I'm also aware that we need to find a solution of a small amount of secure provision if it will be required on the island.
Supplemental.
Thank you, sir. The Minister referred in her answer to a decision made in 2019 when I was Minister for Children. I should clarify that that position was taken by the Council of Ministers against what I had asked them to accept. I wanted this full recommendation accepted. So can the Minister confirm from her answer, which sounds like she's accepting the part of the recommendation which suggests having a centre set up to provide therapeutic support for children and their families. Can she confirm whether that is with the aim of it being delivered at Greenfields, which is what the recommendation originally got at, and when she said about the possibility of maintaining some secure unit provision, would that be at Greenfields or would that be somewhere else?
Thank you for Deputy for his clarification. I wasn't aware, and part of my strategy, it's really to prevent children recurring and going to secure care. It's to provide to build alternatives in the community and intensive support in the community. So the therapeutic children's home is part of the strategy as an intensive support service for young people. I'm sure that Deputy is aware that we have in the government plan ring fence funds to acquire the residential therapeutic home. Also, as Deputy will suggest, we are just looking where and how it will be provided. I found planning application to different redevelopments that was withdrawn. So from my perspective, the work is underway. We need to find the way to provide this as quickly as possible.
Very well. Well, final supplementary, I suppose.
I suppose the last one. Thank you, sir. So just...
Sir, is it final supplementary allowed if it was no supplementary questions?
One moment.
It's not.
I think that's right, actually. Yes. Normally, I'm sorry to give and then take away, Deputy, but the reality of it is that the Minister is quite correct. The normal process is that if there have been no other members asking supplementary questions, there's no supplementary question for you to come back with. And that has been the practice, I now recall very clearly. Yes, right. Moving swiftly on to question number 8, Deputy Scott will ask of the Chief Minister. Deputy.
Thank you, sir. In view of the different options open to government, in responding to the Diversity Forum Legacy Report R-Stop 64/2022 in the current economic climate, will the Chief Minister explain why the government proposes to incur £300,000 in expenditure plus additional related running costs, additional related running costs for the establishment of an international culture centre?
Chief Minister.
Thank you, sir, and I thank Deputy Scott for the question. Jersey has benefited greatly from welcoming different cultures into our community. People moving to the island have ensured our economic prosperity and brought new cuisines, new traditions and new perspectives in the island. We are a more vibrant and thriving island as a consequence. Now, the establishment of an international cultural centre is an important initiative to formally recognise those contributions, to bring islanders together, to provide the space for all of our island cultures to flourish and unite, and to enhance and increase public engagement in the island and throughout all communities. I have set up a steering group led by the Minister for Children and Education, which includes States members and representatives from across Jersey's communities to develop final proposals for the International Cultural Centre. This funding will enable the group to develop that centre, which will provide information about services in Jersey, improve access to those services across the community, to celebrate Jersey's cultural identities, and it will also bring islanders together by raising awareness of our different cultures.
Supplemental, Deputy Scott.
Yes, please, sir. Could the Chief Minister please provide a definition of success, how she proposes to measure success specifically, and whether she has investigated opportunities for private funding in this area?
Thank you. So the Better Life Index identified Jersey's public engagement, civic engagement, as being very low, sir. And I think it's exactly that measure that will demonstrate the success of this project or not. And I sincerely hope that we will see a significant increase to our position in the Better Life Index, and particularly across the gamut of measures there, but in particular in relation to civic engagement. And no, sir, we have not looked at so far private investment in this particular project in its early stages.
Conor St Helier.
Thank you, sir. A dozen States members were in the town hall on Saturday evening for Diwali, including the questioner. Does the Chief Minister believe that the cultural centre, which I fully support, should be in the island's capital? And will she take the opportunity to talk to the parish about whether we could be of assistance in providing such a location? Thank you, sir.
Thank you, Constable. It would always be a pleasure to discuss such matters with the Constable and with the parish of St Helier, of course. As the home to a third of our island's population, it is the natural home. And as I'm sure the Constable is aware, the current location for the centre, certainly in its initial period, will be in the library, which I think is a fantastic site right in the heart of St Helier.
Supplemental, Conor Tom?
No, thank you, sir.
Deputy Tadio.
Thank you, sir. I hope the Chief Minister will agree with me with the sentiment of Oscar Wilde, who says that a cynic is somebody who knows the price of everything but the value of nothing, and that, in fact, this is good investment here and it can't necessarily be valued in economic terms only. But I do have a concern, and maybe the Chief Minister can respond to this specifically, sir, that there seem to be lots of groups being set up, either the Diversity Forum, we can look at Women in Politics, we can look at the International Cultural Centre, and it seems perhaps from an outside point of view that the distinction between what is political and what is civic is not always that clear. And can she assure us that when money is being invested into any groups, especially when there are politicians who seem to be leading it, that it's not simply seen as another area by which pet projects can be pursued, but there is a democratic and civil society direction there?
Thank you, sir. So particularly in our small community, I think there's often a blend between both political and civic. And of course, the Better Life Index I referred to earlier identifies civic engagement in very much a political sense in terms of islanders' political engagement through the ballot box. That's one of their key indicators. But this group is in its early phases. And just this week, I have made a suggestion that a member, a leader of a local arts group might be an excellent person to join the steering group to bring a greater cultural and artistic element to the group and its work as it moves forward and embraces all aspects of our island's cultures.
Supplemental, yes. Thank you, sir. There is a risk, I think, that needs to be avoided and obviated, is that there is also a risk in setting up these groups which may well be at their heart to promote diversity and creating a new form of elitism where we see certain types of people recurringly taking control of these groups, which are also very active on social media and in mainstream media. How does the Chief Minister, how will she ensure that that doesn't happen and that truly these groups, and I would include groups like Women in Politics in that, which I feel in the past have been actually, I'll leave it there, sir. I'll leave it there, sir.
Yep.
But how will she ensure that those groups are truly diverse and not politically led, but actually led by the groups they seek to represent?
Thank you for your interest, Deputy. I think really the aspiration of this independent group is to be an umbrella for all of those organisations. We've talked about it in the terms of it being a cultural compass, and that is because it is going to be there to point people in that right direction, to bring those groups together and to help them unite in their various purposes.
Well, Deputy Alves.
Thank you, sir. Can the Chief Minister provide us with some feedback on how she feels about the recommendations in the Diversity Forum Legacy Report, whether she accepts all of them and which ones she would be making her priority? Thank you.
Thank you, Deputy. So one of the items that we will identify when we're able to publish our Article 30A report, which will address the issues of political responsibilities in various directions, will, I hope, identify some of our acceptance of some of the recommendations in the Diversity Forum's report. That being that we see the need for some political direction in terms of social mobility and equalities, and I hope that we will be able to identify a minister with those responsibilities, also one for disabilities, and equally to value the importance of family-friendly policies and the importance that that has in bringing greater diversity to different spheres of life.
Supplemental, Deputy Alves.
Yes, please, sir. And when will the Chief Minister be publishing this, please? Thank you.
I had hoped that that would have taken place last week, so I hope that it will be coming to Assembly members imminently.
Deputy Doublé.
Thank you, sir. I just want to ask the Chief Minister, as someone who was previously a member of the Diversity Forum and contributed to some of the achievements within the report that's in the question today, does she continue to support the work of the Diversity Forum going forwards?
Thank you, Deputy. Yes, as a former member, I was quite disappointed not to continue as a member of the Diversity Forum, and I certainly support its continuing work because just looking around at this Assembly now, sir, I think we've moved a long way in terms of the diversity of membership here today, and of course there's always more to do, and I look forward to seeing greater achievements in this area as we progress through our 4 years in office.
Supplemental, Deputy Doublé. Final supplementary, Deputy Scott.
Thank you, sir. Could the Chief Minister please name which or any other jurisdictions she has looked at that have an international cultural centre in line with her vision and how their success has been identified?
So this idea came solely from the legacy report, actually, and I think greater minds than mine helped to contribute it in the presentation that we have before us. And so this has been a locally generated piece of work, particularly in response to that Better Life Index that I referred to. And I think it is an appropriate and an inclusive way of addressing the issue and our aspirations for the island.
Very well, we now come to question 9. The Connétable of St Helier will ask the Minister for the Environment. Connétable.
Thank you, sir. Will the Minister indicate whether he thinks that the government can fairly be described as pursuing a policy of, quote, town cramming in St Helier, and if not, why not?
Thank the Deputy for his question.
The Connétable, in effect.
I
Yes.
do beg your pardon.
No, through the chair, I apologise to the
I
Connétable.
apologise to the Connétable. Not a
Very
good
well.
start. Let's see if I can do better.
Let's draw a line and start this one over again, shall we? Minister, off we go, yes.
The Connétable will perhaps not be surprised to hear that I do not agree that this government is pursuing a policy of town cramming in St Helier. However, I do think he raises an important issue, and this is one to which we must remain alert. It's worth remembering that the Bridging Island Plan sets policies that mandate significantly stronger requirements for open space in town. Whilst the plan aims to concentrate development in the island's built-up areas, particularly St Helier, it also makes very clear that the development of town needs to take place in a manner which makes it a better place in which to live, work and visit. And in this regard, there are some specific policies to deal with the provision of open space. To give one example, Policy C18 ensures that developments of 5 to 10 homes are required, quote, are required to provide appropriate communal space for play on site where possible, or otherwise make a contribution to the provision of new or enhanced space for play within 5 minutes safe walking distance or 500 metres from the site. So the plan seeks to support town to grow in a way which enhances and complements its character and identity, where people have a good living environment with access to open spaces and community facilities, such that it becomes a place of choice to live for people of all incomes and backgrounds.
Supplemental.
Thank you, sir. I'm grateful to the Minister for that answer. He will know that there is a proposal to extend the Millennium Town Park, which was part of my manifesto when I was re-elected in June. And he won't be surprised to know that I want to see that happen. He's also said that pocket parks are possible, but would the Minister not agree that the north of town needs a large public park, the sort of place a child can get out of breath in, or indeed a person of my age, rather than park users being put cheek by jowl, which is currently the case during the summer in the town park, and that the generous provision of public green space is the essential quid pro quo of expecting the north of town in particular to take hundreds of new homes.
Minister.
Thank you, Connétable. I thank the Connétable for that supplementary. I think the provision of open space in the town, and in particular the north of town, is particularly important. And I note that the Assembly has expressed a view on this and would like to safeguard that for that extension site in the north of town for an extension, provided that education facilities can also be provided for appropriately. My strong hope and preference is that we are able to find an alternative site for schools and we are able to extend the park, but I'm mindful of the constraints that are in previous decisions of this Assembly.
Deputy Rob Ward.
Thank you, sir. Can I ask the Environment Minister, can you tell us how many planned homes are planned to be built within a radius of, let's say, 300 metres of Millennium Park?
No, sir, I regret I cannot provide that. I'm sure that if we were given a little bit of notice, we could find the answer to that question. I am aware that there are considerable numbers of homes being built in the area to which he refers.
Supplementary, Leader.
Thank you, sir. I can inform the Minister that it's 976 homes are planned, and I've used 300 metres, so it's really quite a wide estimate. It could be 200 metres. Therefore, is the original question of town cramming, particularly the North of St Helier cramming, not absolutely accurate, because that is cramming homes into a very small area, sir? Thank you.
So it's interesting to look at issues of town cramming. Density is, of course, a very important measure of what might be called cramming. It's not the only one, and we need to look at the built form and the way that buildings relate to the environment, which is why open spaces are so important. Areas like Belgravia and Mayfair in London are well built up and have high densities, but are considered reasonable places to live and probably would not be described as crammed. It is important that we look at the whole picture. You can draw circles around you can draw circles around areas and have high densities. You can expand those areas to include open areas and have lower densities. So in general terms, St Helier is not a crammed location. This work was done as preparation for the Bridging Island Plan, comparisons with other jurisdictions, with other equivalent sorts of buildings. The provision of open space is considered to be good in St Helier, with the exception of play areas, and that is an area why I quoted that answer, that statistic, that quote from the Bridging Island Plan in answer to the Connétable's original question. We are mindful of the need to particularly improve access to facilities for children's play.
Deputy Mezek.
Thank you, sir. I mean, there can surely be no doubt that 976 homes within a few hundred metres is cramming when there are currently no guarantees in place about extra green space or places in schools. So what will the Minister be doing to give us those cast iron and set in stone guarantees as soon as possible that school places will be guaranteed for the children who live in those homes within walking distance, and a large amount of open green space provided for those people, many of whom will have no outdoor space at all as part of their homes.
With respect to the Deputy, I feel that it is not entirely within my power to provide all those assurances, and these are decisions that will be made by the Council of Ministers and then with the Assembly to decide. In terms of what I do have within my power, it is to make sure that future planning applications are fit within the planning framework that we've established, which attempts to balance the tension between, on the one hand, wanting to make sure that we sustainably develop land in the areas where the facilities are located, and on the other hand, preserves open spaces. And those two measures are both strongly supported in the Island Plan, and my job will be to ensure that that tension is managed in such a way as to make sure that the quality of life in those areas of town is preserved.
Supplemental, Deputy?
So the Minister referred to future planning applications, but those 976 homes are current applications. They are ones that are already dealt with under the current rules, and as things currently stand without intervention, will go ahead. So is the Minister really saying that at this point he can't say anything to give hope to people who either live in that area or will live in that area, that any guarantees can be given about school places for their children, for traffic management so that they're not constantly breathing toxic fumes as they're walking down the streets in their areas, and that they will have access to open green space? Because it sounds like there's no assurances whatsoever, and that's extremely disappointing, is it not?
I can assure, as I've just mentioned, that I will be attempting to ensure that the policies in the Island Plan are followed to make sure that we do maintain access to open spaces. I've also expressed in my answer to the Connotab my strong desire to see the Millennium Town Park extended, if at all possible. Beyond that, I think that I am at the limits of my powers.
I have Deputy Southern, then Deputy Feltham, then final supplementary. Nothing more on this question. Deputy Southern.
Thank you, sir. Could the Minister inform members what direct input he will have with the Minister of Education in the decisions made as to how many and how much, how many places are found in this particular North of Town area?
I think I assume the question to be referring to the number of school places that might be provided in an area close to the north of town. And I would say that that is likely to be a very live debate involving not just ministers, but the public and all interested parties. And I would hope that the Minister for Education will take my views into account and be listening to them as she would with other members of the Council of Ministers and the Assembly.
Supplemental, Deputy Southern.
The question, sir, and it was a question, was what direct input will the Minister have into that debate?
I'm slightly at a loss as to know what he expects me to do. Do I propose a proposition to my colleague on the Council of Ministers? This is an area of debate. It is likely to be an area of discussion as we look at the various options. The Minister published last week some paper on the question of school places that is likely to lead to considerable debate, and I will be taking a full part in that.
Deputy Feltham.
Thank you, sir. From his answers, the Minister is indicating that he does not feel that there is town cramming happening in St Helier according to his definition of town cramming. Could he inform the Assembly what his definition of town cramming would be?
Yeah, we have policies in the Island Plan that set definitions of hypercramming and supercramming. From memory, the hypercramming is something like 450 units per hectare and supercramming is 150, but I would have to get back to the Deputy to confirm that. So the Island Plan says that in the cases of proposals that come above those thresholds, there has to be justification provided. That would be considered by the Planning Committee or whoever was considering those applications. So we do have policies in place to try and avoid that. and I would expect those policies to be followed by whoever was the decision maker in terms of planning applications that came forward.
Supplemental, Deputy Felton.
Thank you, sir. The Minister further referred to a comparator being Mayfair and Belgravia. Could he inform the Assembly why he thinks that is an appropriate comparison? And if indeed he does, would he undertake perhaps to walk around St Helier Central with myself and my St Helier Central colleagues?
I spent some time last week actually cycling around that area to try and appraise myself more of the conditions there, and I accept fully that it is a dense development area at the moment and there's plenty of building going on to add to it. The question of the comparison was to make a very specific point, which is that density is not necessarily the only method of judging quality and access to open spaces. It is possible to develop in a dense way that also is an acceptable and good way in terms of providing an environment that is a pleasant one and an open one, and with sufficient open spaces. Building form and building density are related, but they're not exactly the same.
Final supplementary, Conor Talbot.
Thank you, sir. Would the Minister not agree with me that the calculation of open space to which he refers in the island plan is fundamentally flawed, because it calculated every square foot of open space, including all manner of small pocket parks and other little corners in the town, and it didn't take into account the number of large parks to which I referred in my original supplementary, in which a person can get out of breath.
I'm not sure the comparison is exactly correct, or the point is exactly correct. The qualification criteria also did not include beaches, for example, which are, of course, available in Jersey and not in many other jurisdictions. So we may have gained in one area and lost in another, so to speak. But the point is about the comparative nature. So I would have to check to be absolutely sure, but I am assuming that the comparison chosen was, the criteria chosen were in order to enable accurate comparison on a similar basis with similar places. So on that basis, it would have been a valid comparison to make.
Well, we come to question 10 that Deputy Felton will ask the Minister for Infrastructure. Deputy.
Thank you, sir. Would the Minister indicate whether he would consider extending the Avanci Access Concessionary Bus Pass scheme for Jersey residents with a prescribed long-term disability to people whose disability does not prevent them from driving? And if not, why not?
I'd like to thank the Deputy for her question. Sir, the concessionary bus scheme is for people with a disability, and its specific purpose is to support those unable to drive on the grounds that their disability would preclude them from holding a driving licence. The primary purpose is not to provide free or subsidised transport. Rather, its intent is to provide this group of people with limited options the ability to move around the island. Any extension to the criteria would obviously have financial implications. However, as a point of principle, I'd be very happy to work with the Social Security Minister, who is responsible for disability, to consider such an extension, sir. Thank you.
Supplemental, Deputy?
Yes, sir. Could the Minister expand on what financial implications he would envisage if the bus pass was made available to the people I referred to in my question?
So that would depend entirely on the demand, and at this point in time I haven't any access to information that would suggest what that might be, sir.
Deputy Tidier.
Thank you, sir. In a similar vein, would the Minister ensure that all concessionary passes, whether they be the Avanci pay-as-you-go, the through fares, or the disabled pass, as we're talking about, are actually much more proactively marketed so that everybody who's got an access to them knows they are? To be fair, I think the disabled bus pass is fairly well advertised, but the Avanci card isn't necessarily, and that provides great savings.
I'm certainly happy to look at that, sir.
Supplementary.
So at the same time, would he consider a generic card so that when somebody presents their card coming onto the bus, they don't have to be identified as one particular group or another? It could be a generic card, so somebody with a disability which may not be visible doesn't have to, if you like, have that shown to the public, which could be considered an issue of privacy and data protection.
So that sounds like a perfectly reasonable suggestion, and yes, I'm happy to look at that too.
Final supplementary, Deputy Felton.
Yes, sir. Whilst some people with disabilities may be able to drive, it may well be more appropriate or more inclusive for them to be able to get into town on the bus. So given that, would the Minister be prepared to look again at whether these people could have access to the concessionary card?
I think that might have been covered under the original question, but in the event that it isn't, I'd certainly be happy to look at that too.
Well, we come now to question 11. The Deputy, Rob Ward, will ask the Minister for the Environment. Deputy.
Thank you, sir. So can I ask the Minister, will the Minister advise what monitoring of air quality, if any, is currently being undertaken in St Helier and around island schools? Thank you, sir.
Minister.
Thank the Deputy for the question. Let me start by saying that I'm very aware of the importance of air quality in terms of public health and the quality of life. I also recognise that urban areas, particularly St Helier, are where air quality is generally likely to be poorest, whilst air pollution around schools is a particular concern because of its potential impact on growing bodies with consequent lifelong potential health effects. Air quality is currently monitored at fixed locations throughout the island by units that provide, on the one hand, continuous monitoring, as well as, on the other hand, diffusion tubes that record longer-term trends. The vast majority of this monitoring takes place in town. Air pollution monitoring falls into two main categories, nitrogen dioxide and particulate matter. A continuous monitoring station for nitrogen dioxide has been in place at the Central Market since January 2008. In November of 2021, the unit was relocated to Beresford Street. In addition, non-automatic diffusion tube samplers are used for monitoring long-term nitrogen dioxide levels at 22 sites across the island. Of these, 18 are in St Helier, with 2 sited at schools outside St Helier, that's St Saviour and Kennervay. These record total monthly nitrogen dioxide levels. These diffusion tubes do not provide peak concentrations, but rather cumulative data to give an indication of general air quality in the area and provide an opportunity to make longer-term comparisons. In terms of particulates, there are 2 continuous analyzers at Beresford Street and Howard Davis Park that monitor particles of a mean aerodynamic diameter of 10 microns and 2.5 microns. That's PM10s and PM2.5s. Unfortunately, the analyzer at Beresford Street is currently offline. A suite of 4 hydrocarbon monitors that sample benzene, toluene, ethylbenzene and xylenes are also placed at a further 6 sites in St Helier. The Air Quality Officer in Natural Environment is currently developing a more reliable and comprehensive air quality monitoring network that will be able to provide near real-time air quality data that will be readily accessible to the public and all key stakeholders.
Supplemental, Deputy.
Thank you, sir. Yeah, may I ask the Minister, can he reassure parents of children in town schools that the air that their children are breathing on the way to school is safe, below World Health Organization levels that would create concern, and that we know of the quality of that air around schools? Because it was mentioned about they're around town, but it wasn't mentioned as to whether they are near schools in particular.
So as my original answer will have made clear, we still have some deficiencies in our monitoring network, which we are hoping to correct, and that is a significant priority. Money has been allocated from various funds, Climate Emergency Fund initially, and then the government plan to address the instrument's deficiencies. However, within the data that we have, our levels of monitored pollution are lower than current World Health Organization guidelines. The caveat to that is that in 2021, the World Health Organization proposed reducing its nitrogen dioxide levels to a level of 10 milligrams, I think I'm correct in saying, 10 in any case, and our current most recent figures was 21. Those new World Health Organization guidelines will be extremely demanding for all jurisdictions to achieve. So I think getting more data to find out where we have the problem will be a critical imperative over the next few months.
Deputy Talia.
Thank you, sir. The area in St Helier, and indeed in the whole island which has the worst pollution, is the tunnel under Fort Regent. Will the Minister explain whether he thinks that it's a good idea for people to walk through the tunnel potentially twice a day with young children, and would he consider steps to try and reduce or even stop the tunnel from being used for pedestrian access?
It's an interesting question from the Deputy. I appreciate the point. As somebody who's cycled in London for 20 odd years with their nose far too close to the exhausts of buses, it is certainly a concern of mine that we should not be exposing particularly young people to excessive levels of pollution. I would say that a journey through the tunnel does not take a huge amount of time, and so these things need to be judged on a kind of common sense level. Once we've got some decent monitoring in place, I think we'll be in a better position to say, but I would not be myself alarmed at walking through the tunnel on the assumption that I didn't linger and hang around.
Supplementary, Deputy.
Thank you. I'm glad that the message to not linger or hang around in the tunnel is a strong message from government. I don't think there's much space to hang around in there. More seriously though, sir, I would question whether it would be wise to downplay the risk from the tunnel itself. If you're somebody who has been walking through the tunnel twice a day, perhaps over 30 or 40 years, and including if you're one of those babies that I see being pushed in a pram along there twice a day, potentially, without having any choice in the matter, that's a very serious potential health issue there. Would the Minister, he doesn't need to give an answer now, but would he consider giving the issue of the tunnel and its alleviation more thought, which may also include restructuring it so that there can be pedestrian access, but which is completely sealed off on one side of the tunnel?
So I'm perfectly happy to commit to looking into that in more detail and to make recommendations in conjunction with my colleague, the Health Minister, accordingly. In passing, I would note that a baby that was going through there for 30 or 40 years would be quite an unusual baby, but thank you.
Conor St Helier.
Thank you, sir. Drawing upon his experience of London and cognizant of the fact that this minister has not been part of a previous Council of Ministers, would he not agree with me that the record of past councils of ministers in regard to air quality monitoring and tackling the problem at its heart is absolutely lamentable? And will he undertake to discuss with the Infrastructure Minister in particular the kind of solutions to the problem that are being used by almost every London borough and council, particularly preventing cars from getting anywhere near the school playgrounds where their fumes are causing such a problem? Thank you, sir.
So I will not be tempted into commenting on my predecessors, but I will say on the second part of the Conatarb's question that yes, I am very keen to work with my colleagues in government to reduce air pollution significantly, particularly as we move forward with tighter World Health Organization guidelines. And I do think that it is something it's quite interesting to note that during lockdown, the monitors kept on monitoring, and the reduction in traffic in the second lockdown led to a 60 or 70% reduction in pollution. The correlation between traffic and pollution is very clear, and we have strong policies to try and deal with that, but I would fully accept that we need to work much more quickly, much more strongly, much more urgently to try and ensure that they actually bite.
Supplementary, Conatell?
No, thank you, sir.
Final supplementary, Deputy Ward.
Thank you, sir. I do feel this is a tradition for me to raise air quality monitoring in this assembly. So I'll just say to the Minister, will he commit, does he recognise that the importance of clear data is one of the things that will drive the cultural change to stop people using their cars around schools and in town when they see the damage that is being done from what comes from their exhausts? And therefore, it is an urgent need to increase monitoring and increase the publication of those levels and inform the public. Thank you, sir.
I'm very pleased to be able to participate in the tradition of answering questions about air quality from the Minister, from the Deputy. Yes, I am very committed to this, and I have mentioned in my first part of in my first answer that this is an area where we are putting in significant extra resources with a view to providing exactly that kind of real-time or near real-time data so that we can point out and react when the data suggests that pollution is at a high level, and we can take appropriate measures. I think it is tremendously important for people to see where that air quality spikes, where there are bad air quality areas, and then we can act on it. And I would also, just in passing, make a comment about the importance of seeing this in the wider context of our carbon neutral strategy and the desire to increase active travel, to increase use of public transport, and to increase the shift to EVs, all of which, taken together, will be beneficial towards air quality, and the reason why when I talk about the carbon neutral roadmap, I always try and emphasise the co-benefits that will arise. So I'm very happy to agree with the Deputy's point.
Well, we now come to question 12 that Deputy Southern will ask of the Minister for Health and Social Services. Deputy.
Thank you, sir. Will the Minister outline what steps are being undertaken to ensure that take-up for the new digital telecare system is greater than that of the community alarm system? And will the Minister further indicate if she considers that doubling the cost to patients to over £250 a year is likely to be counterproductive in increasing its use?
Thank you, sir, and thank you to the Deputy, to the member for his question. To ensure the greater take-up of the new telecare system, we're working to ensure that individuals are aware of the system and how to access it through government channels, communication channels, and also Airtel Vodafone's own communication channels. And currently we have onboarded an additional 73 new customers to telecare. I responded in my response to a written question on 217-2022 on this issue also. I don't intend to change the direction of travel with regard to the transitional subsidy for those who choose to use the telecare service. For those patients who require the service as part of their care package, they will continue to receive the service free of charge, as will those who are in receipt of income support or pension plus. Without the data or patient feedback, I'm unable to opine if the cost of telecare will be counterproductive to its use. However, if the data and patient feedback begin to indicate a reduced uptake due to the cost of the service, then we will look into this and make some amendments to ensure that people are able to access the services that they require.
Supplementary, Deputy.
Thank you, sir. Is it the Minister's target to expand the use of telecare? And if so, will she consider, and has she considered, whether she should be increasing the subsidy to make the use of these devices free?
Thank you. Well, as I've said, I don't want to particularly repeat myself, but I am actually not going to change the direction of travel, but have indicated that if there is an issue around the use and the uptake, then we will look at this to address it.
Deputy Tadier?
So my alarm bells go off when I hear the Minister saying, well, we might make this free in the future so that more people can access it, but we're going to have a period first whereby we don't have as many people, and then if something bad happens, then we might make it free. Is the personal cost and the individual cost of somebody perhaps having a fatality and not being seen quick enough because they don't have these alarms, a price that's actually too high to pay, and we shouldn't be waiting for something to go wrong, and that actually it is within the Minister's gift to simply say, let's forego all the bureaucracy and all the worry that many of, certainly my constituents have, and make this free now.
Thank you, Sarah. I haven't actually said anything about free for all. Basically, what I have said is that for those patients who do require the service as part of their care package, there will be no change to that. There are two groups of people who use this system. There are those who actually need this as part of their care requirements, and there are people who choose to use this for a whole host of different reasons. And the benefit of the telecare system is that it actually has additional options around other aspects of surveillance that families might like to adopt as part of the overall approach to delivering a telecare solution to care and support in the community. But what I can say is that it's really important that we maintain the focus between the two different groups of people so that those who do require it as part of their care package continue to receive it.
Supplemental.
Does the Minister not accept that it sounds to me like we're creating and perpetuating a two-tier system in this? And if I've understood right, that new applicants to the scheme won't be getting it free whilst pre-existing ones will be having it free if it's already free. Does she not think that that will create unnecessary confusion and ill feeling with the public, whereas the sensible thing to do is to offer the same product to everybody, and sensibly, in a rich island like ours, where we're trying to provide better healthcare to all of our constituents, is to make that free at the point of access?
Sarah, as I've said, that for those people who require the system as part of their care package, it is fully funded, and I accept that there will be people who don't require it as part of their care package, but may choose to use telecare by choice. But for those who do choose to use the system, there is a cost which is set to increase, which he highlights, and for those already using the system, there is a subsidy in place to mitigate the impact of the increase. And the first year remains at its present rate of £10.50, and in a year's time we will be raising this to £14, and by July 2025 the cost will be £21. So as I've said before, my intention is not to change the direction of travel in terms of what funding mechanisms have already been set up, but by 2025 it is clear that the subsidy will cease, and that this will mean that there are going to be two tiers of users of the telecare system, which has been the case previously, those being who choose to pay and those who will rightly receive the service free as part of their care package.
Deputy Mayor.
Thank you, sir. The Minister said that she isn't initially going to change the direction of travel on this, and that is a direction of travel which means greater cost to those who use this service. Does the Minister expect us to believe that we need more data to tell us whether or not that makes the scheme more or less accessible? And would she confirm whether this direction of travel of charging more for patients to use health services like this is one that she'll be applying to other parts of her remit?
Thank you, sir. Well, again, as I said, for those who require it as part of their care package, it is free of charge. And there is a choice for those people who choose to use telecare. There will be a charge in order for that facility to be available to them.
So with respect, that wasn't very close at all to an answer to either parts of my question I posed to her.
I think the question was, do you agree that that is bound to have, and I paraphrase, a chilling effect on the take-up of the telecare system if it comes at a significant cost?
Thank you, Sarah. I will repeat that I do accept that we should be driven by evidence-based decisions, and I think data is important when we're actually attributing money to the cost of services, which I know, the member has also alluded to in previous discussions, which is important. But the issue here is that we will make sure that the data drives the decisions as to whether or not the take-up of the telecare system indicates that there is a problem associated with the cost. And when we have that data, we will actually make some further decisions as to what next steps to take.
Supplementary then.
Thank you, sir. Is the Minister suggesting that her proposed approach to this, which is to await data to tell us what we already know it will tell us, which is that this will make this less accessible, so that she can then make a reactive decision on how to make it more accessible, is a sensible way of managing the health of the people who we represent? And wouldn't it not be better to take a common sense approach, which is to start by making this as accessible as possible, which is not the option she appears to be taking?
Thank you, sir. Well, I think that is a view, but what I want to say is that we have committed to actually expanding telecare services. We don't know what the uptake will be. We don't know whether the cost will be prohibitive, and that is why we actually are promoting and engaging people in its use, and at the point at which it becomes an issue as to whether or not this is affordable, we will look at it again.
In an exchange that took place a little bit earlier, I wasn't sure if I missed someone over there who wanted a question. Yes, Deputy Hull.
Thank you, sir. I'm just seeking clarification as to whether the Jersey Telecoms package of the community alarms is being phased out, or has it been phased out already? And I just would like to the Minister to admit to the House that any of the additional apps that are to be included in the new scheme will be at an additional cost for everyone. Thank you, sir.
Be able to assist with that, Minister.
Thank you, sir. What I can say is that I can confirm that the community alarm system is being upgraded to the digital system. So yes, we are phasing out the old system. We've got about 1,040 islanders already subscribed to the analogue system, which basically calls for help when a service user presses a button. But the new system, the existing system hasn't been updated for a number of years, and the technology is being replaced. So when we retendered, we wanted to secure a system that offered multiple connectivity methods, including the mobile network, Wi-Fi and battery backup. And the system that we have now is producing greater resilience than the analogue system. It does offer additional capability and capacity, and additional applications can be added, for example, like motion sensors, pill dispensers and fall sensors. And these are actually going to support some of the care in the community initiatives that are already underway. I can't really give the detail that the Deputy has asked for in relation to the cost of each application, but I would be happy to let you know, or let the Deputy know, the detail of that as we go forward.
Much supplementary.
Yes, sir. Is it possible for islanders to continue with their current community alarms, which many of them find very, they really appreciate? Thank you.
I think we're going through a phased implementation of this. Clearly, this is a dialogue with individuals. What we want to do is sell the benefits But this is a discussion with islanders in terms of what they need. What I can say is that the system, the analogue system itself, will become increasingly difficult to maintain over time. So what we want to do is we want to actually support people to make that transition because we think it offers better benefits.
Final supplementary, Deputy Sutton.
Thank you, sir. And I think the Minister said it at the very end there, because we want the uptake to be as large as possible, because we think it offers a better system. How wonderful. But does she not accept that given the target of increased penetration, increased uptake, then does she not accept that charging for that uptake is the guaranteed way to make sure it stays as little as possible? If you make it free from the start, then you get the uptake, and you will see how many people can take this. And I remind the Minister, if I may, that one of the conditions that we are guarding against is the accidental fall. That means that many elderly people end up very ill indeed and are occupying a hospital bed at who knows what cost.
I think this does have to be a question, really.
And does she not accept that that could happen to her or to me tomorrow? And that sort of cover is what we need.
Thank you, sir. As I've said, I think people who need support as part of their care package actually receive and will continue to receive their telecare free of charge.
Very well. That concludes questions with notice. In accordance with the decision taken by the Assembly before that, we now move on to the statement to be made by the Minister for Infrastructure. Hopefully members will have received a copy sent by email. I call on the Minister to make the statement.
Sorry to interrupt. I don't appear to have received the statement by email or on Teams. I'm not sure if other members have either, but it would be good to have it before us. So I stand corrected.
Magic of technology. Minister.
Sir, as you might imagine, presenting a review of the most recent hospital project creates something of an anxious moment for me, given its complex and long-running background. Nonetheless, it's a review that was very much required, particularly in light of recent global events that are already having a major effect on us here in Jersey. Over the past 9 months, we've witnessed a number of things that would have been unthinkable this time last year. War in Eastern Europe, a fuel and energy crisis, inflation at 10%, and the strong likelihood of recession. Severely disrupted supply chains are giving rise to long lead times for most materials, with corresponding increases in cost. And labour is in short supply as a result of COVID and Brexit. Against this backdrop, international contractors are extremely wary about underpricing and taking on greater risk. As a consequence, fixed price agreements are likely to become a thing of the past as they look to safeguard themselves in this new environment. This, I'm afraid, is the new reality for us. So, when the funding model for the Our Hospital project was first revealed, Jersey was hoping for an average return of 4.6% over a 40-year period on its £1 billion strategic reserve fund. That's 2% above the Fiscal Policy Panel's long-term RPI assumption. And borrowing costs were anticipated to be fixed at 2.5% for the duration. Whilst a period of 40 years is difficult to predict, it's fairly certain that we won't see a return to those halcyon days anytime soon. The strategic reserve won't reach its target this year, by some margin, I'm told, and the cost of borrowing is considerably higher. This change of circumstance, therefore, plays a big part in the review and perhaps unavoidably frames some of the fundamental thinking, particularly the need for a more robust approach to risk management. However, grim as it may be, the situation is not without some opportunity. For example, the amount of information and knowledge accumulated and paid for during Our Hospital process has enabled most of the review work to be undertaken by our existing and experienced local team. The only external assistance has come from the review's principal expert advisor, Mr. Alan Moore. So, by way of background, until his retirement in September last year, Mr. Moore was the Director of Strategic Capital Development within Northern Ireland's Western Health and Social Care Trust. In this capacity, he was the SRO, that's to say senior responsible owner, for the successful delivery of a £1 billion capital investment programme. That responsibility included the delivery of the South West Hospital in Enniskillen, the new hospital and primary care complex at Omagh, the North West Cancer Centre, and the phased redevelopment of the Altnagalvin Area Hospital in Londonderry. Whilst Mr Moore's involvement was being arranged and appropriate terms of reference was drawn up, and given the pressing need to progress matters, a decision was taken not to reopen the site selection process. Instead, a number of more practically deliverable options were selected, and a comprehensive consultation process began, which included some 20 stakeholder meetings involving over 60 individuals. Accepting that the current hospital may be required to stay in service for slightly longer than anticipated, the hospital's maintenance team were consulted at an early stage, and assurances were given that all required resources would be made available to keep the existing hospital buildings safe without the need for unnecessary bureaucratic process. With regard to the review, it's important to state that the focus has, first and foremost, been to ensure that the conclusion would lead to the best possible facilities for both patients and healthcare staff in all areas. In the process, every effort has also been made to combine this focus with an emphasis on some form of project phasing, possibly by way of a dual site or hybrid model, to spread the financial risk over a longer period, deliver better value for money to the taxpayer, whilst recognising the urgent need to progress as quickly as possible. In addition, devising a scheme where buildings could be designed to a scale more compatible with their surroundings, requiring less impact on the existing environment and offering better project access to local construction firms and associated building trades. Also, to allow for future cost-effective expansion using modern methods of construction. As members will now know, the recommended option is to develop facilities on two major sites, Overdale and Gloucester Street, and this will be carried out in two distinct phases to allow for a higher degree of risk management. In addition, to retain the use of the facilities currently being developed at Lekenove in order to prevent unnecessary waste and reduce the area and costs required to replicate them on either of the two main sites. Finally, to implement a swift but comprehensive review of mental health requirements in order to ensure development of first-class facilities appropriately located. Ideally, this work would start immediately. These recommendations are unlikely to please everyone, but they have been reached after careful consideration of the evidence obtained. I firmly believe they set out the roadmap for the best chance of delivering the high-quality hospital facilities the island needs in a way that's both affordable and achievable in the shortest possible timeframe. Sir, the causes of our dramatic change in circumstance lie some way from our shores. No one on this island is to blame for the fact that it is no longer safe, nor would it be responsible to commit to an unstoppable project, the costs of which would fast be approaching £1 billion, were it to be commenced in its current form. With this in mind, I would politely urge the Assembly to give these recommendations their most serious consideration. It's time to put aside the public discord of the past and progress at pace in concert with our healthcare workers, clinicians, scrutiny panels, Assembly members, and all islanders, including neighbours and interest groups. Finally, I'd like to offer my sincere thanks to the Principal Expert Advisor, those Government of Jersey officers directly involved in the production of this review and those supporting its delivery in the background, the stakeholders who provided evidence that led to its conclusions, and the individuals providing quality assurance. Thank you, sir.
Thank you, Minister. Well, there is now a period initially of 15 minutes within which members can ask questions to the Minister. First to indicate, Deputy Farnham.
Thank you, sir, and thank you to the Minister. The hospital review, sir, that we've been waiting for is vague and largely subjective. It is light on detail and it presents little evidence to underpin its findings. It offers no guarantees on savings and ignores other important financial facts, sir. So to that end, can the Minister state unequivocally that the proposed scheme will not exceed the 635 million suggested in the report by its completion some 8 years from now?
So I'll take those in the order in which they were asked. Firstly, sorry, I've lost my thread. I certainly can't guarantee anything. Sorry, could I ask for the first part of that question again? Sorry, Deputy Farmer. Sorry, sir.
No problem, sir. I'm asking, can the Minister state unequivocally that the proposed scheme will not exceed the £635 million suggested in the review upon its completion some 8 years from now?
The answer to that has to be no, sir. It's an 8-year programme. Inflation is running at 10%, and I think it would be irresponsible to try and claim that that's absolutely guaranteeable.
Supplemental.
Thank you, sir.
Deputy?
Does the Minister therefore accept that after applying provisions for inflation, optimism bias, and other contingencies over the 8 years that it will take to complete the project, his proposals could actually ending up costing more than the current approved plan?
Sir, that's highly unlikely because the project as it stands, the hospital project, has already gone up £115 million, and that's the numbers that have been given to us by ROC FCC, the design delivery partner. So there's a fairly sizable differential already, and I don't think that the Deputy is taking into account the value of the risk management that this option provides for us.
Deputy Hegareth.
Thank you, sir. Where is the new mental health facility likely to be located?
Sir, I fully appreciate that Assembly members haven't had a great deal of time to read the review, and I apologise for that. It was only issued mid-afternoon yesterday. But it does say in the recommendations that we're calling for a review, a specific review of mental health services and facilities to commence immediately so that we can actually define what those facilities are and where they're to be located.
Supplemental, Deputy? No, thanks, sir. Deputy Mezey.
Thank you, sir. Since a large part of the rationale for having this review in the first place was to do with the costs and affordability of the scheme, I'm expecting that the Minister should be able to answer this question to the penny. So how much cheaper is what is being proposed in this review than the current Overdale site as approved by this Assembly?
The Deputy looks at page 87, and I certainly cannot, I'm certainly in no position to guarantee anything to the penny because these figures have been provided by Turner and Townsend, who are specialists in this area, but they are suggesting £126 million.
Supplemental, Deputy?
Not just yet, sir.
Deputy Taddy.
So I'm very worried to hear that it seems to me that we're not just now proposing a 2-site hospital, but a 3-site hospital when you take into account Lekeneve, the old Lekeneve school site. And as a long-standing representative for that area, which is the heartland of my constituency, we now find that that's going to be permanently retained as a health site. What discussion was done with representatives for that area? And secondly, how does this reflect on the housing strategy when we don't just see the Gloucester Street development halting in its tracks, but we also now find out that another site which had been earmarked for housing, which I didn't necessarily support and don't necessarily support, sir, has also been stopped by this news that there's going to be a permanent hospital site at Lekeneve.
So the Deputy seems to forget that this is a review and that this is a recommendation, and it's up to the Assembly to decide whether it's accepted or not. Furthermore, it might be worth considering the fact that some £13 million have been spent there, and that if a bulldozer goes in there in 5 years' time, we've got to consider the value for money that we'll have got for that spend. And for the cost of about £2 million more, that site can be made valuable to be used in its new purpose for about 25 plus years. I just think it's a point worth considering in terms of value for taxpayers' money, which I know the Deputy is always so well concerned about.
So I'm concerned about how we take the community with us. It's here in black and white, and I've highlighted it in yellow. The recommended option is to develop 2 major sites and in addition to retain the use of facilities currently being developed at Llanelwy. I've not written that, those are the Minister's words. And so the recommendation is to make Llanelwy a permanent hospital site, which therefore can't be used for other community or housing needs. Is that not the case?
That certainly is the case there, and I think I made that perfectly clear. This is a review, and that is a recommendation.
Deputy Rob Ward.
Thank you, sir. I note the review is used 107 times in the report, just out of interest. So can I ask the Minister, given that there is no detailed business case, and that was made clear to us, how can the Minister be certain of the budgeting, the ability to staff a multi-site position, and the timescale of delivery without any detailed business cases? Thank you, sir.
Produced in just over 100 days. We were not asked to produce a business case because there was nothing to produce a business case for. We've produced a review, and if it's acceptable to the Assembly, we'll go forward and produce a full business case. But I think the Deputy will agree that at this point in time, it would have been difficult to produce a business case for a project that didn't exist.
Supplemental question, Deputy Ward.
Yes, sir. Can I ask then the Minister for when the dates of these business cases will be produced for the Assembly, and will they be before we are asked to make a decision, or will we be asked to make decisions without any detail on the delivery, the costings, the staffing, etc., of this new plan? Thank you, sir.
Yes, that's very likely to happen, very much so. So there's a real urgency for this project, and that is likely to be the scenario.
So can I just, sorry, sir, the word likely, is that a yes or no? Sorry, sir.
Well, I think the word likely is likely. Sometimes things are not susceptible to yes or no, Deputy, and likely is a perfectly reasonable answer, I think.
Let's make that a yes then, sir.
Well, Constable St Helier.
Thank you, sir. The Minister will be aware that the parish of St Helier has been dealing with the implications of the former hospital project for some time, with many parish assemblies, a lot of expensive legal work, and I believe we are still subject to compulsory purchase orders in respect of certain parcels of land owned by the parish. Does this review give me the ability to go back to my parishioners and say that the threat to St Helier has been removed? The threat to our trees, the threat to our parks, the threat to our parking spaces, the threat to the bowling club. Thank you, sir.
Sir, I fully appreciate the Constable's concern, and I'm afraid to have to say that not at this stage. There's a likelihood that may come in not too long a time, but at this stage, I'm afraid I can't guarantee that.
Sir, could I just ask the Minister when that reassurance will be forthcoming, because we do have a lot of stakeholders who are clearly concerned about this.
All things being equal, we're going to try and lodge a proposition before Christmas, and we'll just go through the normal procedure, and that'll be hopefully early next year.
Deputy Sutton. I'll come back to you, Deputy Sutton. Deputy Scott.
Thank you, sir. With apologies for if I'm overlapping with Deputy Tadier's question, but am I right in thinking that this proposal will release the former Llanelwy school for much needed housing within St Brelads as a parish? And if so, will the Minister give his support to that?
As I said, and I've said a number of times, all of these decisions will be made by the Assembly. So it isn't really a matter that's within my grasp.
Deputy Scott, supplemental.
No, thank you, sir.
Deputy Andrews.
Thank you, sir. In relation to the capital repayment with the existing bond, as a percentage compared to the strategic reserve and also the other reserves, has the Minister contemplated the expense that would be incurred currently as it stands compared to the reserve growth? Thank you, sir.
I'm showing my ignorance again, so I'm not quite sure what that question means. Could you perhaps be more specific?
Sir, essentially what I am saying is with the existing bond that's already in the market, if we are looking at the coupon, so if that was to be made payable on a per annum basis compared to the current trends with our reserve growth, does the Minister believe that actually we are in a good position to potentially proceed with the bond, bearing in mind our reserves have actually grown by about 481 million last year?
So I think the intention in this instance would be to look at the funding again completely from scratch. That's to the best of my knowledge.
Supplemental, Deputy Deputy Kovac.
Thank you, sir. Can the Minister clearly then state that this is again going back to the consultation and reviewing state, and have those costs of delaying consultation and reviewing being factored in?
So it depends what the Deputy means by going back to the reviewing stage. We've been quite clear about the fact that we're not going back to site selection, and the plan here would be to use all the information that's been accumulated, talk again with all the parties involved to take that information forward to build a case to fulfil the requirements or the recommendations of the review.
Supplemental, Deputy.
Yes, thank you. So hasn't responded if this consultation and reviewing that's been carried on is factored in, and still related to cost, has the cost of stopping the Kensington Place work been also factored in, and the penalties they have to pay to the companies who already had signed contracts in place there?
So in relation to the cancellation of the contract, that's still being finalised, so I'm not in a position to know what that number is. And relative to the actual scheme itself, it does actually would represent a very small percentage, probably under the somewhere under 0.5%, I would guess.
Conatapa Trinity.
Thank you, sir, and thank the Minister for the review, which arrived in my inbox at 2200 last night. So I apologise that I haven't had opportunity to study it in great detail, but I did appreciate the briefing this morning. One thing that jumped out at me from the slides we saw this morning was the red, amber, green risk analysis. And for the two-site option, the one that really flagged up for me was the ongoing cost or maintenance cost of running a two-site hospital. I thought that way back when Deputy Anne Pryke brought the two-site option, that one of the negatives for that, the big negatives for that, was the actual cost of running a two-site hospital as opposed to running a single-site hospital. And today there's also a suggestion that maybe we maybe spread across 3 sites. And I would hope that significant cognizance is given for the actual ongoing costs rather than the, it's jam today or jam tomorrow, really. So I'd just like an assurance that that's been properly taken into account. Thank you, sir.
Yes, sir. I think it's been taken into account to the extent that it can be at this point in time. I would also point out it was the only red on the chart, and it doesn't actually indicate the fact that with the two-site option, you've got a lot of resilience in the case of having another pandemic. You've got 2 sites, and you've got greater flexibility. You've also, and something that perhaps wasn't taken into account in the first scheme, is you've got room to expand on both sites, and I think that's highly valuable depending on where we go with population growth in the future.
That actually brings the time available. Can I assume that members may wish to proceed for an additional 15 minutes, which is an option provided for within standing orders?
Sir.
Proposed and seconded?
Yes, sir.
Member Show? Very well, we'll proceed for another 15 minutes. Supplemental Conatapa Trinity? Deputy Balash.
So may I, on behalf of the Jersey Liberal Conservatives, first of all congratulate the Minister on bringing a breath of fresh air to this debate. My understanding is that the recommendation is that we should be going for a hybrid phased option, which seems to me, on the face of it, to be a sensible solution. I'm going to come to a question straight away, sir.
Thank you very much, Deputy.
But May I ask the Minister whether he is intending in very short order to bring a proposition to the Assembly which will bring some certainty to the many issues, some of which were mentioned by the Constable of St Helier in relation to Overdale, to revoke the decisions made by the previous Assembly so that we can move forward in the direction adumbrated by the Minister.
Firstly, may I say how much of a relief it is to hear a friendly voice in the Assembly. And yes, I can say that the intention is to bring a proposition which would, on the one hand, rescind the existing scheme and give rise to the proposals. Thank you.
Supplemental, Deputy Welsh. Deputy Felton.
Thank you, sir. I'm trying to get a handle on quite how far back this takes us in the project process and whether this is actually taking us back to square one. Could the Minister clarify whether the clinical requirements previously agreed for the hospital now need to be revisited due to this process?
I'm fairly certain, and I'm not an expert in this area by any means, that some of those clinical requirements will have to be revisited with a view to making sure that everything would be appropriate for a two-site solution. So, yeah, as with regard to going back to square one, most definitely not. In the coming weeks, we're shortly to receive a full planning permit for the scheme, for the Our Hospital scheme, and as everybody here will know, applying for permission to build something that's considerably smaller, possibly half the size of what's been permitted, should be considerably easier than starting from scratch. Given that there'd probably be no need for certainly, I doubt there'd be a need for a planning inquiry, and it's a much more straightforward process. Also, building a building of half the size should be achievable in a shorter space of time. So, as much as it might commence a little later, there's a hope that the finishing date for the revised project might be quite a lot sooner than it would be for something of nearly 70,000 square metres.
Supplemental, Deputy.
Thank you, sir. The Minister previously referred to potential expansion on the Overdale site should it be required in the future. So are the requirements being adjusted to suit perhaps a smaller population than the previous plans? Is this just really a phased approach to a larger hospital on the Overdale site in the future?
I don't envisage a large expansion on Overdale should this proceed. But what we did see when we were in Northern Ireland, we visited a factory that produces modern methods of construction. And what is apparent is it's not difficult to add operating theatres or wards to existing buildings. And I would envisage that the design of the new building at Overdale would be designed in such a way as to accommodate that sort of extension were it to be required.
Deputy Sullivan.
Thank you, sir. Will the Minister correct me if I'm wrong, but is it not the case that we spent 10 years on this and now we're going to save £126 million by simply building a smaller hospital? Is that not the case?
Yeah, so the Deputy might have spent 10 years on the previous projects because he has been a member of this House, but I haven't, sir. And as I say, this is a review that's been put forward with a view to saving money, and in my book, £127 million is actually quite impressive, and I don't know what the Deputy thinks of that, but I think it's a sum of money worth saving, given that it's taxpayers' money.
Supplemental, Deputy Sullivan.
Yes. The question actually revolves around, are we simply building a smaller hospital? And will that meet our needs? The answer appears to be no, because we actually want to expand later on.
Sorry, I think you've already answered the question then. Minister. Sorry, did you want to answer the question? I was being probably inappropriately flippant. Very well. Yes, Deputy Farnham.
I have so many questions, I'm not sure which one to ask, but I'll go with the one that states, or asks, can the Minister explain exactly what the savings are and how they were calculated.
Great deal of time. I think if the minister looks in the at Appendix 5, for example, there are two cost assessments, one by Turner and Townsend, which are cost consultants, and another done by Mr. Alan Moore, and both provide quite extensive detail as to how those calculations were made. I could read them out, sir, but it would probably take me about 20 minutes, and I think that's probably rather pointless.
Supplemental?
Thank you, sir. There is. I beg to differ, but I cannot see any extensive detail in this report. I can see some high-level predictions and speculation, but certainly no extensive detail, sir. So, will the minister then, if he cannot explain how these savings are going to be met of 126 million, could he then perhaps explain what the additional running costs of the hospital, the duplication running perhaps over 4 sites, because as I work it out, so it would be 4 sites, Gloucester Street, Kensington Place, Overdale and Kennervay, where there's uncertainty around. Have the sums been done, sir, to work out to my calculation, sir, if running over 4 sites as opposed to 1, perhaps put 2% on the costs of the health budget, sir, which is not unreasonable, that would wipe out any savings, sir, over a fairly short period of time.
Sir, no cost predictions on running costs have been done, and I don't mind saying it might have been rather pointless because there aren't any running costs to compare them to for the last project, because I don't believe that the Deputy produced any at the time.
Deputy, if you've asked to ask a question, but generally ministers can't ask questions.
It's a point of order, actually, sir.
Oh, it's a point of order, yes, please.
But I'll leave it to the end of the questions if you like. I just wanted to put my light on for a point of order.
Point of order, very well. We'll wait till we get there then. Deputy Mezek.
Thank you, sir. In answer to my earlier question, the Minister gave a figure for how much he said could be saved with this project. The Constable of Trinity asked about the operational costs of this being the highest of the options that were examined in this review. Could the Minister confirm whether the figure for savings that he has come up with therefore includes the ongoing greater operational costs, whether they include potential compensation that might need to be paid to developers for work already incurred, whether it includes the risk that the planning application could still be rejected? In fact, sir, as I go on, actually, could I instead ask the Minister to list all the things that aren't included in that calculation and provide clarity that way instead?
Easier if it's not a long list, but if you could do 1 or 2 at a time, I'm quite happy to answer all of those questions. If you want me to list all the things that aren't included here, I could go on forever. And I say these are indicative costs in any event. It's a review, it's an initial review, and it's not a business case.
Supplementary, please, sir.
Supplementary indeed.
Thank you, sir. Of course, the reason the question gets asked, sir, is because upon first impressions of the report, it simply isn't clear whether it is credible to say that this will end up being cheaper overall because of all the questions there are still on what is not included in these figures given for how much savings could be made. So, sorry to push the Minister on this, but can I push him to give a list, if he is able to, of the essential spends that ought to be considered in this which haven't been included in the figure he has given before? I did give some examples like compensation to developer for works that's already been done, like potential risks of planning applications not being accepted, like ongoing costs for maintaining the current hospital. Which of those can he tell us off the top of his head have not been included in that figure he gave earlier?
Risks are very difficult to quantify in monetary terms. I think one has to take a common sense approach to this. One of the 2 main sites has already got a permit which is shortly to be fully issued, and the other is adjacent to an existing hospital. So, as I say, this is a review and one has to take a common sense approach to it. Does it include compensation payable to a developer? I don't believe it does, and as I've said, if it does, it'll represent less than 0.5% of the overall project costs. Sorry, could I ask you to repeat, perhaps ask another 2 questions? If we do them 2 at a time, it's a little bit easier for me to provide the answers.
I don't mind if you want to clarify the last part of the question that you are asked.
Perhaps I shouldn't say this, but I'm not sure it's in order for me to do so because I only listed some of what could have been a substantially longer list. I was trying to get the Minister to preemptively give
Very well.
every
Thank you
cost
for
that's
that,
not
then,
included.
Catherine. You are quite right. Deputy Ward.
Sorry, me?
Yes.
Sorry,
Sorry,
sir.
I beg your pardon. I do try and remember to put the initial in. Deputy Rob
Okay,
Ward.
sir. Thank you, sir. May I ask the Minister, can he categorically state that there will be no additional works to the roads going up to Overdale, given that a two-site option may mean increased traffic flow between the two for, well, unknown reasons, because we're not entirely clear as to what the two things are going to have in them? Thank you, sir.
It's very unlikely to be anything substantial, sir, and certainly very unlikely to be that which was envisaged for the first scheme. If one was to go down that road, then all the economics change in any event, and the figures that have been presented probably wouldn't stand up.
Thank you, sir. And has the Minister taken into account with a three-site, one of them being on the other side of the island, the increased movement of staff that might be necessary, the increased movement of patients that may be necessary, and will therefore the cost of transporting people be included, which could be substantial over time? Thank you, sir.
So I think the first thing to bear in mind is quite a lot of people live out at the west, and secondly, these are not facilities that are necessarily directly hospital related. There won't be any operating theatres or anything of that sort. It'll just be health related facilities that are on that site, which could be located anywhere on the island and not necessarily essentially located at a hospital. As I say, it also reduces the capital cost of whatever we build going forward, which I think is quite helpful.
Deputy Tadier.
Thanks, sir. There was much to criticise of the previous government, but what they did leave us was with certainty about where the hospital was going to be built and when it was going to be delivered. Now we have a situation where we have none of those. We have delay and we have uncertainty. Does the Minister agree that if he were outside of the States looking in and he'd listened to a statement and a document being delivered with such lack of detail, including, for example, the opportunity costs, looking at the Kensington Place site, so we're including the fact that we're paying for the delivery of 100 plus homes without actually having any homes for it, because that will be the payoff to the contractor, and that the fact that when those homes are ultimately delivered, the cost of delivering those homes will also have gone up. Where are all those figures, and what were the actual true costs, including opportunity costs for this scheme, to deliver a project at some point in the future, which doesn't have planning permission yet? Is it going to be worth it, sir?
Taking the last one first, yes, I certainly think it will. And it appears sadly that the Deputy doesn't recognise the difference between a review and a full business case. And as I've explained, the next stage of this would be to produce a full business case. I'd also ask the Deputy how comfortable he feels about the prospect of signing up to a contract which would probably exceed £1 billion in the current environment. And perhaps I'm not in a position to ask questions, but it's just a point for everybody to ponder on, sir.
So my
supplemental question?
My supplementary, sir, is that figures can seem big, sir, but what I do know is that they can be, whatever the cost is, that it will have to be paid for over a long period of time. I'm concerned that we still won't have a hospital delivered in 4 years' time at the end of this government's tenure, and that my constituents, if I'm still around and I'm knocking doors...
Definitely, if you don't ask your question, there won't be time for any answer at all. We're literally seconds away.
The question is, can he ensure that the hospital will be delivered at the end of this tenure?
Reputation for resting on my laurels, and I've worked hard up to this stage, and I intend to work extremely hard going forward. So the answer is an unequivocal yes.
Well, that does in fact bring the second period of questions to an end. You had a point of order.
Thank you, sir. I would be most grateful, as an incoming member of the Assembly, I'm looking at an extant decision, sir, of P80/2021, which set out budget, financing and land assembly, which the Minister has explained. It set out maximum expenditure of 804 million. It set out a borrowing authorisation of 756 million on the basis that contractors were in place. I've learned here, I'm a member of the government, sir, but I wish to have a direction, if I may, perhaps not now, but maybe you'd consider what advice you'd give to the Assembly of an extant decision that simply, from the words of the Minister, can't be delivered, and what actually the options for the Assembly are, because there's an extant decision which I now understand could not have been delivered, cannot be delivered now, and what should be done.
And what is the identification of that extent decision you were looking at?
The extant decision is P80/2021. It's one of the reasons why I and other members of this Assembly stood, because we didn't quite believe what we were hearing, and I now understand it can't be done, and I understand the Minister is in a very difficult position, but I wonder if you could
And what
assist.
ruling are you seeking?
I'm seeking a ruling of what to do that this Assembly has in terms of a ruling of an extant decision that can't be done.
Well, if it can't be done, it can't be done. I mean, if the Assembly has resolved to do something which is incapable of achievement, then ipso facto it's incapable of achievement.
So what is the extant decision, sir?
It's effectively, I suspect, but I will give it further consideration, any decision is de facto rescinded, because if the Assembly chooses to do something which is completely at odds with what it's decided to do before, that's effectively an implied rescindment of the earlier decision.
So it's a de facto, that my point was politely to ask, sir, whether or not it is a de facto rescindment or a rescindment is required, but perhaps you consider that.
I'm very happy to consider that. Thank you for advice on a future occasion.
Thank you, sir.
So can I raise a point of order following on?
Yes, of course.
It seems that what we've just had there is a request for a decision on a standing order, from a direction from the chair on something that's entirely hypothetical. So Deputy Joseph made a statement which is of hypothesis. It's not proven one way or the other, and is asking you to rule on effectively what's the political matter about the hospital, sir.
Well, I think the way I interpret it is that I'm to look at P80 of 2021 and see if any issue arises under standing orders. I haven't assumed that it does. I haven't assumed that anyone is correct about it. It's just something to look at afresh, and if there is a ruling that can be made and it's appropriate to do so, then I'll make it. If I take the view that it's not appropriate in connection with assisting the Assembly in the conduct of its business, then I won't make one. Very well. We now come on to the next stage of business, which is questions without notice. The first period of questions is the Minister for International Development, and 15 minutes starts now. Conataba St Helier.
Thank you, sir. Could I ask the Minister what her international development and island identity priorities are for the year ahead? Thank you, sir.
I thank the Constable for his question. As is written in the ministerial plan, I'll just highlight a few things out of there. We plan to strengthen our dairy work. Earlier this year, I signed an MOU with the Minister in Zambia, and we plan to start a multi-year dairy project in Zambia. We're hoping to host the third Jersey Africa Forum in July 2023, and where we can promote Jersey, the Jersey cow, and our expertise in the dairy industry. This has huge amounts of value to Jersey's reputation in Africa and in the world of international development. We're expanding our team and training them up so they are well versed in monitoring and impact analysis. We're going to broaden and enhance Jersey's philanthropic reach, expand our volunteering offering, and also with the island identity, we'll be implementing policies with ALOs and other departments within the states. We're hoping to change the narrative and expand the comms that we use when to ensure that we're all singing from the same hymn sheet, as it were, and sort of put out an international message of what Jersey is about. We're not just an international finance centre. And personally, I'd like to set up a framework and a database for Jersey's diaspora and hopefully send out newsletters to them to extend that network.
Supplemental?
Yes, so I'd specifically, particularly interested to know what the Minister's priorities will be with regard to the situation in Ukraine and whether that, if the war does continue, how she will grow and enhance that support in the coming months.
Well, the Ukraine at the present time is a devastating crisis, not only for the vulnerable people in the world, but globally too. This year, Jersey, through Overseas Aid, the charity Side by Side, and you, sir, have put out huge amounts of efforts into fundraising, and Jersey has raised 2.722 million. That puts us per person at £19.96 per person. By comparison to Guernsey, which is £12.61, and the UK, £5.83. So we have a budget for emergencies. We also like to keep some back for our pooled fund and other emergencies, which we're mindful can be forgotten in this Ukraine crisis.
Connétable of St Martin.
Thank you, sir. My question has actually been asked fundamentally by the Connétable of St Martin's, who sorry, of St Talia, so it's actually been answered. Thank you.
Very well. Deputy Farnham.
Thank you, sir. We are seeing high inflation in not only in our own island, but in many countries around the world. So how will that impact upon the Minister's budgets and the good work that her department does?
In 2021, we set our budget, we fixed it with the rate of GVA. So our budget will keep pace and be expanded automatically as our economy expands and depreciate proportionately if it contracts. But what is fundamental at this time is that we don't renege on our giving. It is absolutely fundamental that we stick to our pledge and fix it to GDP, and I'm hopeful that it will go up by 0.1% year on year so that we reach OECD averages. But the Deputy is correct. This cost of living crisis is having a huge amount of impact to the vulnerable. It is putting an added 47 million people into poverty. And that was before yesterday. There was something happened in Ukraine yesterday. They've now blockaded the ports the Russians have blockaded the ports. So the cost of living is set to increase. The cost of living on grain increased by 5% just yesterday. So it is a huge issue.
Supplemental. Deputy Barbara.
Thank you, sir. I understand that countries want to help the poor and alleviate suffering around the world. As a new member of the Assembly, sir, may I ask the Deputy, are there any particular reasons why Jersey is involved in overseas aid? I know you've alluded to some, but yeah.
Thank you for the question. There are 1 billion people malnourished in the world. There are 2 billion people who don't have access to basic sanitation, and 5 million children die before their 5th birthday every year. So that, to my mind, is reason enough to contribute to the aid. But we actually signed up to Agenda 21, and as a wealthy jurisdiction and conducting business on the international stage, it would be incredible reputationally not to contribute to the agenda targets. But probably one of the most important issues for me is that we were actually recipients of international aid ourselves. I believe the Channel Islands are probably the only jurisdiction on British soil to have received international development aid ourselves within living memory. And if you'd like to read my forward in the strategic plan, the first paragraph, can I be indulged to read this out, sir?
If it's a directly relevant quote, it's not normal, but I think in the circumstances, if you're trying to illustrate a point by simply making 1 or 2 points from it, you wouldn't want to read out entire tracts or anything of that nature.
Okay, it's a paragraph. Stop me if it goes on too long. So if I can say...
Well, you've already exceeded the time for answering the question anyway.
All right, I'll leave it with members to read it themselves, sir.
Very well. Supplemental question then.
No, the deputy's actually answered what was going to be my supplementary anyway.
Deputy Tadia.
Thank you. Sticking with the theme of the occupation in Jersey, does the Minister share my concern, and this was with a cultural identity hat on, sir, that up until now Jersey hasn't really commemorated the bravery and the remarkable works of many of its local women over the years, and that one individual who could be commemorated better, I know there are some plaques and stones in the island that do speak of her, is Louisa Gould. And as we approach and think about the occupation every year, is it something in her mind that we could do either through her piece of work, through culture, or even through the Bailiffs Consultative Panel about looking at what future memorials we have to great women in the island?
Pushing against an open door there, Deputy. I would welcome any cultural additions to our public realm, especially if they acknowledge the vast contributions women have made to our community. And there are a lot of them, and I don't see any of them out there in our public realm, not obviously so anyway. And if it were a case of acknowledging Louisa Gould, who I know made great efforts during the occupation, and in fact lost her life over it, I think it's something that we should very much consider a work going to contribute to her, and I'd like to see anything like that involve schools, students, women's groups, and that sort of thing, so we can raise the issue.
Supplemental, Deputy?
I will, sir, simply to add that obviously Louisa Ladrilleneck was her maiden name. I think it's important to remember women's maiden names as well, sir. Could this be a suitable project potentially for 2025 as we look to celebrate the 80th celebration of liberation and the occupation? And obviously we missed the 75th one, so I know that you put a lot of work into that. And that for the 80th one, it could be part of that. To commemorate her bravery, and also the fact that she died on the 13th of February in 1945 in one of the camps for her bravery.
I think that would be an excellent idea if we looked to commemorate her and other women.
Deputy Hull.
Thank you, sir. Please may I ask the Minister, with all the goodwill in Jersey, is there any way that islanders can get involved with the work of international development and overseas aid? Thank you.
That's a good question and a very timely one, because on the 15th of November, we have the launch of our community work projects for next year. We intend going to Rwanda, Nepal and Kenya, and it's open to the public, and it's certainly open to states members to participate and put themselves forward to volunteer for our projects. In yesterday's JEP, I noticed in the editorial, it spoke about social prescription. And I think this is an excellent way to benefit from that. Our volunteers come back and say that the experience that they've had can be life-changing. It also develops skills and experience, and it's good for employers because they have a more rewarding employee at the end of the day. But there are other ways. We have bursaries, we have professional bursaries. We've put in place our UN placements, so offering young islanders a 2-year contract with the UN to work in the front line with UNHCR in refugee camps. And we have our 3rd placement going out in January. So wonderful opportunity. We've also got JIDN. We've set up a networking organisation to establish and bring together organisations, the private sector, philanthropists, and charities. So there's plenty ways to get involved.
Supplemental, Deputy?
No, thank you, sir.
Deputy Mensah.
Thank you, sir. As the Minister who leads on some of the fantastic work that the Overseas Aid Commission does in helping some of the most vulnerable people around the world, and in particular refugees, would this Minister like to take the opportunity to disassociate herself from some of the disgraceful comments made by others in political roles describing refugees as invaders, and would she pledge to never allow that kind of rhetoric to enter that sphere in our political system, and will she be a champion against that kind of divisive and nasty rhetoric?
Well, clearly I don't support rhetoric like that. I think it's absolutely appalling. And I believe after yesterday's news, the UK really need to take a long, hard look at their processing centres and also maybe familiarise themselves with our constitution.
That brings the questions to this Minister to an end. I'm in the hands of the Assembly. Normally at 12:45 it will be a responsibility of the presiding officer to ask whether the Assembly wish to continue or to adjourn. There are now 2 periods of 15 minutes still to go in questions before we move on to public business. We can continue, or we could adjourn now and return. I'm in the hands of the Assembly. Does anyone wish to make a proposition? The adjournment is proposed. Is that seconded? Very well. I'm going to assume that as nobody is leaping up, anxiously trying to do anything different, we will adjourn. And the Assembly stands adjourned until 2:15.